Thank you so much for joining us on this important day. I'd like to begin by acknowledging the traditional custodians of all of the lands on which we are meeting today and pay our respects to elders past, present and emerging. We extend our respect to our Aboriginal and Torres Strait Islander colleagues and guests who are present today and note that sovereignty has never been ceded. So again, welcome, and it's lovely to be with you all again on Rare Disease Day. Today we celebrate our genetic, undiagnosed and rare disease community. Individuals and families, carers and communities, health professionals and researchers, support groups, advocacy organisations, the NDIS, service providers, industry and government, academics and philanthropists. It's a large community, and today is about harnessing our team for maximum results. Before we look at what's ahead of us, I would like to mention that and pass on the apologies of a number of our parliamentary colleagues who have asked me just to let you know that this day is important to them, but for many reasons, and not least of which is what's going on around the country and has been for some time, they're not able to be with us today. Focusing on rare disease is not something that most of us need to think about or have a special day for. It's our everyday. That's one reason today is so important. Today we say to the rest of society, we are here. We are important. We are vulnerable. And we need your help. Today we say enough is enough. We focus and celebrate our similarities and not our differences. Today, we say it's time to move forward. Our community deserves the same considerations of our needs, the same opportunities to live our best lives, and the same courtesy of choice and access as everyone else. We also say to each other, let's work together. Let's seek opportunities. Let's harness our strengths. Let's collaborate for change, and let's be a force. We challenge society. Are you ready to agree that from a social justice perspective, it is right and just to give all persons living with a rare or genetic disease access to the testing and treatments they so urgently need as soon as these exist and are available? Are you ready to agree that it is no less important, ethical and desirable to improve the health of a small fraction of the population with dire, unmet medical, social and civil needs than to address the needs of the multitude? Today we say indifference and inaction is not an option. And how do we go about that? Well, we've got as always, a full agenda for you all today. And our morning will unfold with a presentation from me about the GSNV team. So who is on our team? I'll share with you who we think is on our team and how we identified and recruited that team. And I'll talk about what we're doing in 2021, how that team will work together in 2021. And I'll also talk about what we'll be doing in 2021 to be on your team. We'll then explore the journey of the Mito Foundation and the Childhood Dementia Initiative through a shared conversation, how they've built their teams, how they've harnessed the power of their teams. We are beyond grateful that Sean and Megan will share their stories with us today. You'll also have the opportunity to ask Sean and Megan any questions that you wish, any questions that will serve you to achieve your objectives. You may choose to put them in the chat, but please use the chat for your comments and put your questions in the Q&A function as we go through all of the morning. Please don't hesitate to utilise the experience and skills of Sean and Megan. I'm sure they wouldn't mind me saying that. And ask them any questions that would be useful for you in your pursuits to have the answers to. After hearing from Megan and Sean, we are also really fortunate to have the team from Two Peas in a Pod. Mandy and Kate are a team that support each other, and they've created an amazing support network through their podcasts. Mandy and Kate will talk about how they built their team and how their support teams help them live their best lives. Again, we are blessed that Mandy and Kate are happy to take questions from you. And you might notice on the agenda there that they call themselves PFessers. So they'll tell you what that means. And I love that that's how they view themselves. As always, I have a long list of expectations from the day and what will be delivered. We've built our program today around ensuring that we deliver these outputs and outcomes. They're all important. But the most important on this list, I think, are the three at the bottom. None of us can deliver what we need to or want to on our own. We need to help each other to help our communities. And knowing is one thing, but feeling that is also really important. So we want you to leave knowing and feeling that you are not alone. We want you to leave knowing and feeling that together we are stronger. And we want you to leave knowing that we're on your team and you're on ours. So I'm going to talk about who the GSNV is in 2021. I'm not going to talk about what the GSNV did in 2020. So we've published our year in review, and you may have seen that, and really happy to share that with you all through our communications. But I thought I would look to the future today rather than look to the past. One thing I will mention was that in 2020, the GSNV developed a new strategic plan. So it was time to renew our focus. And in putting together a new strategic plan, and many of you will have been part of the consultation for that, we developed a new vision and a new mission and a new program of work for the next 3 years. So our vision is that people living with genetic, undiagnosed and rare conditions flourish and live their best lives. And how are we contributing to that in 2021? We are engaging widely. We are advocating purposefully. We are representing strongly. And we are supporting wholeheartedly. And I'm going to talk about each of those areas and the work that the GSNV is doing and how together as a team we can work towards those things. So firstly, engaging widely, not wildly. We might do some engaging wildly, but we'll be doing that widely as well. So it's really important that we engage locally, nationally, and internationally. There is so much happening around the world that today, or on Rare Disease Day is Sunday officially, but already there are events happening all around the world, and there will be events next week as Rare Disease Day branches out and becomes almost Rare Disease Week. And in some cases, Rare Disease Month. But what's important about that is we're seeing more and more focus on the issues that are associated with living with a genetic or rare condition, or caring for somebody living with a genetic, undiagnosed or rare condition. So some things that we've been doing, or that we are doing, to engage widely in 2021. We'll be writing to all your MPs. In fact, we've already written to them, but we haven't sent out our communication yet. And that's to remind every electorate in Victoria and every federal electorate in Victoria that every MP has people living with genetic, rare and undiagnosed conditions in their communities. And we want to put that front and centre for them. We want them to know how many people in their area. And so we're writing to them to say, this is how many people in your area, and we are also including in our communication a letter, in that letter, the support groups that are in that MP's electorate, just to say you need to know who is in your electorate. So that's one way we're engaging in 2021. That letter will go out in March, and we will let you all know if your support group is in one of our letters, and it certainly should be if you're a Victorian support group. We'll have and have always had events and engagement. So this is one of our events. We will be holding co-working days. But I will talk a bit more about those a bit later on. But we will continue to host events for our community, and we will continue to engage with events around the state and around the country. And they'll be cross-sector. So one of the things that's really important is we know that to live your best life, you need many different contributors to that. So our engagement is not limited to the genomics sector or the health sector or the rare disease sector. We are also engaging with industry. We're engaging with government. We're engaging with VCOS. We're engaging with the Consumer Health Forum. So a broad sector. That's really important, because we are building, as you need to build, the team of people that you're going to need to deliver what you want to deliver. Nationally, we're also engaging widely. So you would have heard me talk in the past about GARD, and the GARD Collaborative Australia is a collaborative that consists of the GAA, the Genetic Alliance Australia in New South Wales, the Genetic and Rare Disease Network in Western Australia, and Swan Australia. So those four organisations work together to ensure that we have a loud national voice on your behalf. We've also been engaging with Queensland Genomics, and Queensland Genomics, some of you will be aware, are moving into their sunset period and will disappear soon, but their legacy will be strong in Queensland. And their support for support groups in Queensland will remain strong and is one of their legacy projects. So we are engaging with them about how we can work with them to serve the people of Queensland using our experience and the experience of all the GARD organisations. And again, that has to be cross-sector. So dealing with organisations like the NDIA, for example, as a cross-sector consultation and engagement. We're also committed to engaging internationally. So we are, the GSNV are members of the Asia Pacific Alliance of Rare Disease Organisations, and that is a group of organisations like ours right across the Asia Pacific. And the GSNV, I've recently joined the board of APARDO, so we're having some influence over what are the issues that APARDO is concentrating on for our region. We're also engaged significantly with Rare Disease International, who are looking at what are the significant issues that should be addressed at an international level that can cascade down and flow into solutions at more local levels. So it's important that we're part of that conversation. And we're also engaged with a project called the Collaborative Global Network for Rare Disease. These are all such complex kind of titles, aren't they? And that is a project with the WHO and Rare Disease International, and it's about looking at how we deliver better results through the health system for people living with rare and genetic conditions. So there are lots of things happening to ensure that the engagement that we are having is directed at being able to flow through to solutions or to influence the work that we're doing so that we can deliver better results. And like you, advocacy is part of our DNA, isn't it? It's really important that we advocate purposefully. And some of the ways that we will do that in 2021 is through submissions. So the GSNV supports many submissions through letters that go with your submissions, or support organisations, support groups to write submissions. And that's important because voices to government, voices to MSAC and PBAC, voices to parliamentary inquiries are voices that are united into those forums are critical to continue to get our voice heard. And one of the mechanisms, as cumbersome as sometimes it is through that submission process. So, and we're looking to do that, sometimes the GSNV, sometimes the GARD Collaborative Australia, so that we are doing that on a national scale, and sometimes both. So just for example, the GARD Collaborative Australia have submitted to the NDIA for the 3 disability inquiries that are happening at the moment. We submitted to the parliamentary inquiry on novel medicines, and processes for novel medicines. So those things are purposefully directed at getting the things that we need. We're also always looking for every chance that we can get to present the lived experience of people with genetic and rare conditions, to present the opportunities to all of the people that we collaborate with, to say, hey, you need to know these things because you need to work with us on the solution. So we do presentations to the clinical genetic hubs, to the Australian Society of Genetic Counsellors, who are key contributors to all of our teams. We've got a psychology webinar series that we're running with the Australian Psychology Society, so the APS, throughout 2021. And that series is about helping psychologists to realise that people who have lived experience of rare conditions and their families need different things than somebody who may have had an injury, and that there are complex needs right across the rare disease area. So it's an introduction to psychologists to say, you need to be across these things, and you need to be thinking and understanding what our community needs are. And we will continue to do reports. We will continue to report our progress using the Department of Health National Strategic Action Plan for Rare Disease. And that's important because we have a wonderful framework that we need to be able to say, this is the work that we're doing to contribute to the implementation of that. Because it's important that that plan is implemented for all of us. So I'd really encourage you to have a look at the work that you're doing as well, and to see where it fits in with the recommendations that are in that plan, so you can report as well and say, this is what your organisation is doing to support the delivery of the plan. Representing strongly. So this is something that it's really important that organisations like the GSNV are seeking opportunities to represent our community, and doing that actively and pursuing those opportunities. So I just wanted to share with you where we will be representing you in 2021 that we know of at the moment. So I'm sure there will be more opportunities for all of us. But at the moment, we know these things. So we know that we sit on the National COVID-19 Clinical Guidelines Task Force Consumer Panel. And that is a panel that is developing living guidelines for the treatment of COVID-19 and bringing a perspective that says that when you put guidelines in place, you need to consider these things for our community. And on that consumer panel, there are people that represent remote communities. There are people that represent Indigenous communities. There are people that represent the LGBTQI community. So it's a wide and varied, and many others, it's a wide and varied panel to ensure that clinicians are aware that a one-size-fits-all approach is not okay. So that's why we sit on that task force. We sit on the Ingena Steering Committee. So Ingena is an industry genomics alliance. So it's an alliance that that is made up of pharmaceutical companies, of medical device and medical technology companies. And that alliance has come together to provide a voice for industry into the genomics health area to say, well, these are ways that testing could be improved. These are ways that treatment could be improved. And not just the process, but the interface between research and translation. So we are the consumer representative to Ingena. And I should have said as well, we'll continue to communicate with you the work that these groups are doing, because it's really important that that work is alive for all of us, that we can see how that's moving forward and how it could serve us. So, and each of you. So we'll continue to keep you informed about that. We sit on the Precision Healthcare Steering Committee for the Australasian Institute of Digital Health. And now that's important because, as we know, there are many advancements being made in digital health. There are many issues associated with data. The Genomics Blueprint document has just recently been released. So that is a digital roadmap for genomic data or an information management of health data. So that is definitely worth a look for each of you. But we sit on that Precision Healthcare Steering Committee, and that means that we have a voice, you have a voice into what's happening in that digital health space. We chair the Mackenzie's Mission Engagement Reference Group and RD Now Consumer Advisory Group. So they're projects that are happening that are substantial projects that are piloting amazing things in Mackenzie's Mission case across the country. And for RD Now, that's a project for undiagnosed populations out of the Royal Children's. So it's a paediatric project. Mackenzie's Mission is a carrier screening project. But both of those, we are representing the consumer voice and being able to say, you need to communicate in this way, or these are the concerns of patients that are on an undiagnosed rare disease journey. So that's important, because if people are aware of those things, then we have a chance of changing them. If people aren't aware, we don't, as you know. We sit on the Royal College of Pathologists Lay Committee. So that's a committee that has dialogue with the Royal College about these are the concerns that our community has. Melbourne Genomics, Australian Genomics, we represent into projects on the Melbourne Genomics Consumer Advisory Group. So we take our representation role really seriously, because it's a way to magnify our voice. We sit on the Victorian Genomics Clinical Advisory Group. So that is a group that oversees the $8.2 million rare disease initiative that was announced by the Victorian state government about 3.5 years ago. So that project has funded across all of our genetic clinics some testing that would not have been available without that initiative. So we are the consumer representative on that committee, saying you need to be thinking about these things and considering the pathway that a patient is following as they move through the testing process. We also sit on the Carrier Screening Reference Group, and that's the group that fought so hard for so long to have CF, SMA and Fragile X carrier screening testing put onto the MBS. And you may be aware that that decision has been made and is currently sitting with Greg Hunt, with Minister Hunt, for his sign-off. And then that testing will be available under the Medicare scheme. So what a fantastic outcome for the carrier screening reference group. But it's not finished. It's got lots more work to do, and we know that about. So we need to expand this. How do we add to that? And consultations, and again, every chance we get. So we're not very good at saying no, and we don't intend to get very good at saying no. If we're asked to participate, then we will do everything we can to participate, because we have to be there. We have to be at the table. And supporting wholeheartedly. So these are the things that specifically we are doing in 2021. And I want to talk about those projects in particular that the GSNV will be focused on. So we've split them up into groupings. So we have a Care for Rare program. So our Care for Rare program includes our mental health working group, and our mental health working group has had its first meeting, and that working group is about exploring what is currently available in the mental health space for people living with genetic, rare and undiagnosed conditions. Is it adequate? When do people have access to it? What are the gaps? And looking at what we can do in the short, medium and long term to specifically address those issues. And we've got a really diverse group with lots of different expertise and experience on that group as well. So that's going to deliver some things over the year that we will be sharing with all of you, including the tools that are currently available. It will take us longer to develop things ourselves if things are missing, but we will be seeking out what exists and sharing that. And sharing is going to be an important focus for the GSNV in 2021, but I'll come to that. We also have the Patient Pathways program. So the Patient Pathways program is a program via which any person living with any rare or genetic or an undiagnosed condition can access a telehealth nurse to help them to navigate both the health system and the social services system to be able to live their best life. So if your communities or your family are struggling with, well, what do I do next? Or how do I get past this barrier? Then the Patient Pathways program has been designed to help you. It's a federally funded government program, and you can access it through our website. And the relationship then is between you and the telehealth nurse. So that nurse will work with you to put together the plan that you need to help you get, or your family or your community, what they need. So please, if anyone is thinking about, well, I'm stuck, the Patient Pathways program is a really good vehicle to help you get unstuck. Wellbeing Week. Wellbeing Week is a week that we did run in 2020. It was a week that was focused on areas that we felt were important to people's well-being. So it included a program, Mental Health First Aid. It included a peer support program. We had an NDIS workshop on how to actually work with an NDIS planner and the local area coordinators. And we looked at family violence in the disability sector. And we will do that again in 2021. We will most likely spread it out, because you may have thought, as I said, that, hey, that's pretty intense. And yeah, I think it was pretty intense. So instead of doing it in 1 week, we will do it over a broader period of time. But those things are really important to our community, that we understand how we can support each other and how we can support our community with very specific tools and in very specific areas. So that's our focus there as well. We are absolutely thrilled with our new website. If you haven't been to the GSNV website, please go and have a look. We have revamped our website to make it easier to use. So please go and visit our website, and you will see when you visit that we have formed a relationship with Rare Connect, and Rare Connect is an international collaboration of support groups. So it is moderated by the European Rare Disease organisation Eurodis, and groups are moderated. So it's very well served, but it's an important way to connect with people with conditions that are important for you and your families to be able to connect with. There are plenty of Australian families who are part of Rare Connect. There are also international families from all over the world that will allow you and your communities to be able to connect with all age groups, all types of experience, and have that relationship with someone who's going through the same things as your families might be going through. We also have a Share for Rare program. So our Share for Rare program, sorry, just excuse me, I'm going to put my glasses on for a moment. Our Share for Rare program is a program that is about recognising that many of us and many of the people that we work with who are on our team have skills, have resources that would serve all of us.
Met East Building, ground floor, Specialty Clinic A3, room 317. Met East Building, ground floor, Specialty Clinic A3, 317.
So there's Murphy's Law. We are broadcasting from the Royal Children's Hospital this morning, so it's important that announcements are made. We wish they weren't made during our broadcast, but we will stop when they happen. So my apologies for that. But I was talking about our Share for Rare program. As part of understanding what's important to share at different times, we have looked at, well, what is the life cycle of a support group? And what does a support group need at different stages through that life cycle? And what should it be able to share with its community at different times during the life cycle? So that could be in establishment, where it's really important to have the right governance frameworks in place. It's really important to have made the right decisions and have thought through, well, what kind of a support group are we going to be? How are we going to do the things that we want to do? And then as an organisation grows, it might be a decision between, do you remain a voluntary organisation or do you start to have employees? Do you seek funding? Do you seek donations? Are you an organisation that has DGR status, for example? So on our Share for Rare, in our Share for Rare area, you will find lots of information around what are the expectations or what you should be thinking about developing into, or at least the decisions that you need to be thinking about to decide whether you want to develop into that area or not. And as part of that, we want to invite all of you who've been developing resources for your communities to share them with us, and we will share them with the broader community. So lots of you have done some incredible work in developing resources for your community that are, and resources to go to people that are on your community's team. So for example, you might have developed resources for your community to take to schools. You might have developed resources for your community to take to the GP. You might have developed resources to assist with NDIS conversations. If you're happy to share them, we would like to share them with everyone, so that when another group who is getting to that area of their development to say, hey, we should be sharing this kind of information with our community, no one's starting from scratch, no one's reinventing the wheel. So we will have a library that will have all those resources in them. And the copyright will always be held by you. So that's important just for people to understand. And you'll see terms and conditions that are associated with that. So it also shows you that we're thinking about, well, you know, these documents are important and a lot of work has gone into that original development. We also have a skills bank available. And again, we're inviting all of you who have skills to share with our community to tell us what those skills are and what you would like to share. We've done that. So you can find all of us, all of the GSNV team on our skills bank already that say, these are the skills that we have, and if you would like them, they're available to you. So just for example, one of the things that I'm good at is strategic planning. So if you're thinking about developing a strategic plan, part of our skills bank is that you can actually say, we're developing a plan, we'd like some help here, and I can come and help you do that. Our Share for Rare program is really all about reducing the burden that is on support groups. We know that times are tough, and times are always tough, aren't they? But we know that it doesn't get any easier. So we're really focusing on how can we help? So ideas for what we could be putting in Share for Rare, please. We're really open to those. But that's where we're starting. And we also have our wonderful volunteer network. You may have been lucky enough to have had a project delivered with one or two or more of our fantastic volunteers. We have about 48, and they are all high quality individuals in every way. And it's not quite the right term, but I'm not sure what else to say. We like lend them out to support groups so that they can help you, so that they can help you achieve the things that you want to achieve. So please, you're really welcome. There's a process, again, on the website that you just need to follow to have that delivered. Or to have a volunteer come and help you deliver. And just a couple of projects I wanted to highlight for you, because one of them is going to be near and dear to your heart today. So we're doing a couple of things in the health literacy area. So I've talked about our Genomics in Schools program before. So with the challenges of last year, we weren't able to roll that out, but we will be doing that this year. So we will be educating teachers so that they can share case studies and have discussions about choice and ethics and things like that with their classes. So we've developed a teacher's guide and presentation that has case study videos and things in it. So that will roll out in 2021. And Mygenesandme is a fantastic little program that we're hoping you will help us with, but I'll talk more about that just before the break. We now have 3 fantastic directories that are available to you. So we have a conditions directory, we have a support group directory, and we have a services directory, or a community directory. So please have a look at those because they're easily searchable. They're deliberately structured to make it as simple as possible for you and your community to find what you need as easily as you possibly can. So please have a look at those directories. They're there and available. And support for grants. So we have our grant writing boot camp where we've had people come in and talk about, well, this is how you write grants. But we've stepped that up. We've got some people interrogating the grants as they're available and actually then providing to our community information that says, hey, this is a grant that we think as a community we might like to apply for, and then working together to say, okay, well, instead of one organisation, let's look to get a larger piece of the funding pie and 10 organisations or however many organisations are interested in being involved. So that's something that will roll out as the year goes on as well. There are other projects too, and you will hear about those as the year goes on. And as always, we're really open to hearing your suggestions about what we should be doing as well. But how do we get all of that done? And this is a long list about who is on our team at the GSNV. And most importantly, we think you're on our team. And you're on our team sometimes as a contributor to the work of the team, sometimes as an ideas person, sometimes as a collaborator. It doesn't matter. We are all those things to each other on an ongoing basis. So that's important. You're on our team, and we're in whatever capacity you can be on our team, we're really happy to have you on our team. People with lived experience are on our team because, well, they have to be. That's why we exist. But they also provide us with that honest benchmark that says, is what we are doing real? Does it impact in a real way? And only our community can tell us that. So critical team members. The broader community is on our team because we want the broader community to give more support to people with lived experience and those who are supporting them. And I've put the media with the broader community as well, because the media are so influential in the broader community. So it's really important that when we think about the community on our team and we think about how to influence them, we know that we need to engage the media and influence the way that the media presents our community as well, and the issues that are important to our community. And there is so many things that are happening around Rare Disease Day that it will be interesting to see what the media coverage of that will be. But it's Rare Disease Day 2021 has been significantly more active in seeking to engage the media. So let's see how that goes, but we won't stop. We will keep seeking the interest and the ear of the media to present how we know it's important. The Department of Health, so the Department of Health in Victoria and also the Department of Health federally are on our team. Volunteers and students, so I've talked about our wonderful volunteers, but students are also on our team. We are fortunate to engage with students from the Masters in Genetic Counselling and the Masters in Genetic Health, and we are also fortunate to engage with the academics that are also involved in those programs, so that we can ensure that those students and the academics have a deep understanding of the role of support groups and the communities that the support groups represent and serve. So they're on our team. Genomics Alliances, so Australian Genomics, Melbourne Genomics, and all of their significant networks, they're on our team too, because we need them to understand when they're thinking about their research projects, when they're thinking about engaging across the community, when they're thinking about recruiting for research projects, we want them to be considering the things that we know are important to our communities. So they're on our team and we're on theirs. Key sector support network. So I talked about how important it was that when we think about our community, that we're not just thinking about the health community. We need to be thinking about broader sectoral representation as well. So the Consumer Health Forum, the NDIA, the Health Issues Centre, VCOS, ACOS, really important that we are continually putting in front of those organisations. You need to be thinking about us, and we need you to be supporting us in these areas too. Health professionals, of course. We are blessed to have so many wonderful health professionals in Victoria and across Australia, and to be engaging across the world. And they are on the GSNV's team, and they're on your team, they're on your community's team, they're on your individuals' team. So we will continue to invite them to at every type of health professional to be part of our team, and to ensure that they know that we're on theirs as well. Researchers, industry. So like I said, this is a long list, but it's a really diverse list. And the reason that it's a really diverse list is because we have a diverse job to do. So we know that we need all of these people on our list to be able to best serve our community. So establishing who's on your list and why and how you're going to engage with them is a critical piece of how you serve your community. And it was our goal to have a workshop on Monday to be able to talk about with you face to face. Imagine that. To be able to talk about, well, how do you put your team together? Who do you need on your team? And unfortunately, for all kinds of reasons, but the overriding reason was our most recent challenge in Victoria with COVID-19. So that was not able to happen. So we will run that workshop. So that workshop will happen a little later in the year, but we will definitely have it. But if you can start thinking about who you need on your team, and then we can talk about, well, how do you get them? How do you build that team? And I'm going to share with you how we made our decisions for who's on our team. So your strategic plan is really the first place. That's where we started, with understanding what we're seeking to achieve and why we're seeking to achieve it, to be able to articulate that, because when you're putting people on your team, you need to be able to gain a common understanding about why everyone is on that team. What is everyone working together to achieve? So our strategic plan was our first consideration. And then our mission. So what are our areas of focus? And any of you that have known the GSNV over some time, you would know that our vision hasn't changed very much, but the way that we go about delivering that vision has evolved. So our team has got bigger because what our areas of focus are have increased. Our objectives, so what we need to be doing, that very specifically, these are the actions that we need to undertake, has guided us to say, well, if that's what we need to do, who do we need to help us do it? So how do we get it done? That conscious decision making that says, how do we get it done? And that's where we need all of you, and that's where we need that team that I was showing you the slide before about. All of these people work with us and we work with them, because we can't do it on our own. We know that. We can't do it alone. So again, that question to you, so who's on your team and why? And how can we help you? Because we are on your team. So how can we help you? So I promised you that I was going to talk a little bit more about Mygenesandme. And Mygenesandme is a viral campaign that we are really hoping to launch into the broader community. And you can see there that it's about building health literacy, promoting inclusiveness and community, to actually get people, and COVID has brought us all kinds of challenges, but one thing COVID has done is we've heard the word genomics a lot more in the last 12 months than we'd heard before. So we want to get people thinking about genetics and genomics and their genes in a positive way. So we're encouraging the community to make really short videos, 10 to 20 second videos. We've got some examples to show you. Don't take too much notice of the first one. I think it's the first one. It's not my favorite, but you'll recognize the person in it, I'm sure. But we're encouraging people to make those videos, and we want to get them shared and tweeted and out and about, and everybody making just a really short snapshot that says, my genes mean, and then a statement, so that we can put it in the front of people's minds that your genes are important. And they are something that each of us should think about, and should think about, well, what do our genes mean to us? And you can share whatever you wish. Like I said, we've got a couple of examples. So the project will seek to begin the conversation and create some momentum. The link is in the chat function. So if you would like to, and there is a YouTube video that actually helps you with how you go about making your video. So our hope is that today, everyone who's online will make a video. It's really clear on how you do it, and we'll show you some examples.
Hi everyone, my name is Carrie Klein, and most of you know me as the project assistant at the Genetic Support Network of Victoria. I want to tell you about a project we're doing right now called Mygenesandme. I'm going to tell you about the purpose of the project, why we're doing it now, and ways you can get involved. So the purpose of Mygenesandme is to create a conversation about genetics and genetic diversity in the Australian community. Our goal is to build health literacy, to promote inclusiveness, to build public familiarity with genetics, and to involve the genetic, undiagnosed, and rare disease communities in positive engagement with the broader community. So, why do we need this project? It's easy for the general community to view genetics and genomics from a science and medical perspective. This immediately puts up a barrier for a lot of people. In fact, genomics and genetics is a very personal subject that most individuals don't have any relationship with. If we can build a positive relationship, then we can potentially impact some of the issues surrounding consumer engagement and confidence in sharing health data, introduce concepts such as genetic diversity to reframe discussions around bullying and discrimination, and familiarize people with the language to empower them in their own health journey. So why now and why the GSNV? As the pace of genomic advances moves in huge strides, we at the GSNV have a role in ensuring that the community keeps pace. Steps are underway to mainstream genomics in our health systems, which could further disengage people from the health journey if it remains a mystery. If we do not progress initiatives like these, like Mygenesandme, as a society, we will not move forward and will be facing the same issues of low levels of genomic health literacy and inaccurate messaging with the next generation. So why the GSNV? As the GSNV is uniquely placed within both the health and support sector, we are well suited to run a project such as Mygenesandme for a number of reasons. The GSNV understands the science, the health system, and the wider lived experience of genetic, undiagnosed, and rare disease. The GSNV also understands the importance of engaging with our community and the broader community around health empowerment. So what can you do to get involved? The next steps is I'm going to show you our disclaimer, some example videos, and if you have any questions, ways to contact us. So, how to submit a video. I will show you on the disclaimer. As you can see on our disclaimer, we are currently working on a project called Mygenesandme, which seeks to begin a conversation between the GSNV community through video testimonies. Simply put, we are asking you to send us a 10 to 20 second video, that's all, about what your genes mean to you. Here are some other ideas of what you can respond with. My genes connect me to my family and my personally Hungarian heritage. My genes make me who I am, and they are the blueprint for my body. My genes help me to grow tall so I can play basketball, and my genes contribute to my genetic condition, whatever it may be, which means fill in the blank. Then we show you how to take a video. Just as this woman demonstrates, you're just going to want to have your phone in portrait mode at arm's length. That's the best way to capture the video so we can edit it and keep all the videos the same. So you're going to place your phone in portrait orientation, arm's length, have your head towards the top of the frame, and feel free to film with a family member, have your pet with you, anything else that you want to make your video fun. Then all you're going to do is click on the link which will take you to our Facebook page, and you can message us your video right away, or you can attach it to an email, info@gsnv.org.au. If you want to submit it on Facebook, you'll just go right to our page, which is facebook.com/genetic.support. Our chat box should pop up, but if it doesn't, you can just click on message. So not contact us, just message. And you'll just click this icon here, attach photo or video, and you can get it right from a file on your phone or a file on your computer. So back to the disclaimer, you're going to continue. And this disclaimer must be completed in order for us to use your video that you give us, and this can be read and accepted below. You're going to agree to, I know my story is important and I consent to tell it. You agree that your testimony response can be used in its entirety and may be edited purposely to respond or inform. You understand and agree that your story can be shared across a variety of media. Understand and agree to your photograph that can be used with your story by the GSNV, and acknowledging that you can request that the GSNV remove or refrain from telling your story or using your video at any time, and that is no problem. So once you click accept, you will enter your name and let us know if you have any questions about submitting your video. Of course, if this disclaimer form isn't working for you, we can do it another way. Just email me. We could always do it over the phone. So, we can make that work. I would type my name, and that is me filling out the digital disclaimer. So that is how to fill out the disclaimer. Here, I'm going to show you an example of a few videos we've taken with our GSNV staff and our wonderful volunteers.
My genes tell me that if I don't get to the hairdresser soon, I'm going to be grey all over. In genetics, I know that my genes are extremely complex, and I love learning about the underlying mechanisms that make me who I am.
My genes are what make me who I am. They're the best bits from my dad and the best bits from my mum all combined into me.
My genes tell a story about my heritage. They're my past, my present, my future, my strengths, my weaknesses, and they make me who I am.
My genes might make my fingers go bendy and my knees dislocate, but my genes also make me curious about how genetics contributes to human disorders. How do mutations work? How do they make us who we are? How can we better support those with genetic conditions? That's how my genes drive me forward.
My genes tell me a lot about my ancestors and connect me to my Sri Lankan heritage and family.
My genes make me an individual. They have helped me to become the unique person I am today.
Great, thank you to everyone. So that's it. That's how you submit your video for the Mygenesandme project. If you have any questions at all, just contact us at info@gsnv.org.au, and I really look forward to seeing your videos. I'll see you at Rare Disease Day.
So please, we would love, love, love you to make a video, and we're going to take a 10-minute break so you can dive in straight away.
My genes tell me that if I don't get to the hairdresser soon, I'm going to be grey all over. Being a genetics student, I know that my genes are extremely complex, and I love learning about the underlying mechanisms that make me who I am.
My genes are what make me who I am. They're the best bits from my dad and the best bits from my mum all combined into me.
My genes tell a story about my heritage. They're my past, my present, my future, my strengths, my weaknesses, and they make me who I am.
My genes might make my fingers go bendy and my knees dislocate, but my genes also make me curious about how genetics contributes to human disorders. How do mutations work? How do they make us who we are? How can we better support those with genetic conditions? That's how my genes drive me forward.
My genes tell me a lot about my ancestors and connect me to my Sri Lankan heritage and family.
My genes make me an individual. They have helped me to become the unique person I am today.
Welcome back. I hope you all had a good bio break. And it's now my absolute pleasure to introduce two incredible people that we are fortunate enough to have as part of our sector, who have done incredible work. But I'll let them talk about that. Firstly, we have Megan Donnell with us, and Megan is the Chief Executive Officer of the Childhood Dementia Initiative and former CEO of the Sanfilippo Children's Foundation, which is an organisation that Megan founded following the diagnosis of both of her children with a rare form of childhood dementia, Sanfilippo syndrome. Under her leadership, the foundation raised over $9 million and within 7 years, transformed research in this little known condition. The foundation today has sustained revenue and continues to drive quality research into Sanfilippo internationally. Megan's groundbreaking work earned her Research Australia's 2017 Advocate of the Year award. Megan's strategic acumen and ability to build collaborations and create change were honed during her 15 years international experience as a change manager, management consultant, and a project manager in leading companies, including Deloitte. She holds an MBA and a postgrad diploma of management. We also have Sean Murray with us, and Sean is the Chief Executive Officer and a founding director of the Mito Foundation, with multiple generations of his family affected by mitochondrial disease. Sean is deeply motivated to drive the impact of the work of the Mito Foundation in supporting the Mito community and ultimately finding a cure for Mito. Sean has lived and worked in Australia, the UK and the US, and has broad industry experience in both private and government sectors, covering advocacy, business consulting and general management. Sean is the chair of the Australian Genomics Community Advisory Group and a member of the Mackenzie's Mission Engagement Reference Group and the Lee Syndrome International Consortium Governance Committee. See, you have to be on people's teams. And he holds a degree in computer science and pure mathematics from Sydney University. Sean, I did not know that about you.
It's a dirty little secret there, Monica.
And it is my absolute pleasure, Sean, to hand over to you and Megan, who are going to have a conversation about their work and their experiences. Thank you.
Thanks so much, Monica. What an introduction. It makes me want to actually hang around and listen to those two speakers. They sound fabulous. Thank you so much for having us along today. It's a real honour, and we are huge, speaking on behalf of Sean here as well, huge admirers and supporters of the work of GSNV. And it's so tremendous that you're putting on this session today in celebration of Rare Disease Day. When we first spoke about joining, Sean and I were actually going to speak separately. And when we had a look at what the topic was, who is on your team, and we had to think about the kinds of things that we might cover, it made sense to us that given our journeys have been kind of done in parallel, and we had a lot in common. And also that we'd each been on each other's team informally for a number of years, and we're actually now formally, which we'll talk about a little bit later. So we just thought today it might make sense to just have a conversation and talk about the experiences that we've both had on the journeys from starting an organisation right through to where we are today, and who has been on our team throughout those many years. So Sean, you and I actually have quite a similar background, and our previous professional experience had nothing to do with this field. So that's something that we certainly have in common. We were both kind of thrust into the world of rare disease, as a lot of people are, I think. So do you want to talk a little bit about how you came to be interested in Mito?
Yeah, sure. Thanks, Megan, and thanks again from me to GSNV for hosting today's session. It's great to be part of it, and rather humbling given the wonderful introduction there. I want to meet that guy as well, and those two people. So mitochondrial disease, we call it Mito for short, it's a relatively common rare disease, I guess, compared to some of the rare diseases, and it actually represents a collection of different diseases. There are about 309 genetic mutations that can cause mitochondrial disease. And how I got involved is my family has a type of mitochondrial disease that's impacted our family. And while we knew for generations that there was something wrong, it wasn't until my brother got diagnosed. Well, my brother was unwell in his mid-30s. Prior to that, he lived a pretty healthy life, and he had what was thought to be a stroke, and he ended up in hospital. And for a otherwise fit and healthy 35-year-old man to have a stroke is pretty unusual. And so I investigated that, and it was quickly determined that it wasn't a stroke, it was something else. And then he had, I guess, fortunate for him, he ended up in the right place where the right doctor asked the right questions and asked about, how's your mother, how's your family history, and was quickly able to then hone in on a potential or a suspected mitochondrial disease. And so ultimately he was diagnosed, and that then actually provided answers to this cloud of mysterious ill health that had hung over my family for generations. And so after my brother was diagnosed, my mother was diagnosed, and my grandmother was retrospectively diagnosed. She wasn't alive at that time. And then my other sisters and I, all my siblings, were also diagnosed as having the genetic change that can cause mitochondrial disease. Now, the thing about mitochondrial DNA is that it's different to nuclear DNA, and it sits outside the nucleus of the cell, and it sits in the mitochondria, funnily enough, and it you can have genetic changes in the mitochondrial DNA that can cause mitochondrial disease. And the quirk of mitochondrial DNA is that you inherit it 100% from your mother. So in my family, we have a change in our mitochondrial DNA, and it's 100% inherited. There is another complexity about heteroplasmy, but that's way too complex for now. So it just means that everyone in my family, all my siblings are at risk of developing the disease at any time. And one of my sisters is actually symptomatic at the moment. And any of my sisters inevitably pass that on to their children, but I haven't passed it on to mine because it doesn't inherit. So that's how I got involved in mitochondrial disease. This was in the mid-90s or the early 90s. And as part of that, my family and I volunteered to participate in research studies, and we were part of some clinical investigation into the impacts of exercise on mitochondrial disease and so on and so forth. And then at some stage, the clinician who was running those research studies said to me, there's a guy by the name of Doug Lingard who has a child with mitochondrial disease, and he wants to start a foundation, and he's keen to talk to you. And so I was introduced to Doug Lingard, our founder and still current chairman, and he invited me to join the board of the what was then the Australian Mitochondrial Disease Foundation. And the rest is history. I guess we're going to talk a little bit more about what happened from there. But so Megan, I guess my experience is really coming in and joining a team, and Doug had already assembled a group of volunteers, a lawyer, a banker, and all the kind of, he'd gone explicitly to find some people who brought certain expertise, and he assembled them all in and started this whole journey off. So Megan, your experience is different. How about you? How did you get involved?
My experience is different, but I guess like you, it followed a period of, we're all familiar with the diagnostic odyssey. And although mine didn't go over generations, mine began with my children. So when Isla was 2 years old and Jude was a newborn, we first started to notice a few very mild developmental delays in her. And that began a period of almost 2 years, or just over 2 years, of kind of running around different doctors, pediatricians, having all sorts of interventions like speech therapy and occupational therapy and that kind of thing. And being kind of labelled as that neurotic mother who's convinced there's something wrong with her daughter. And I think a lot of people here today are probably familiar with what that feels like. And the people, I guess, who were on the team at that time were the allied health workers, the paediatrician. I don't think any of them really, thought that there was anything significantly wrong with Isla. And in the end, it was an educator who said to me, actually, I can see what you're looking at, and pointed me in the direction of a group who made the eventual diagnosis. And that diagnosis was Sanfilippo syndrome, which is a rare form of childhood dementia. It's recessive genetic. So my husband and I both had a mutation in the same gene. We had a 1 in 4 chance of any pregnancy that we had resulting in Sanfilippo syndrome. And I'm sure a lot of people on today understand genetic recessive and how things are inherited. But I have to say, at that time, 8 years ago, I was like, my biology was never good, and I was kind of scrambling trying to get my head around it. But it did dawn on me in the diagnosis room that, oh, I've got another child and there's a chance he may have it too. So we had him tested, and unfortunately he also had it. And so that was very difficult to hear. And I think that initial diagnosis was a shock. But it was also a bit of a push for me to get out there and understand what was happening and really get my head around the disorder and what might be available to them. And at that stage, there wasn't anything available. There was some clinical activity happening in terms of trials internationally, but nothing happening here in Australia. And I met a bunch of other families, and I saw actually there's a big opportunity here for us to make a difference for these kids and this generation of children. And so within 3 months of their diagnosis, I started the Sanfilippo Children's Foundation, and I had absolutely no idea. Happy to say retrospectively that, I didn't know what I was entering into, but I knew that I wanted to make a difference. And so I started to talk to lots of people who did have an idea, people who ran charities, to people in industry, to people who were researchers or pharmaceutical people, anybody that would listen to me basically and get advice. And I guess start to validate the idea that I had of what I thought we could do as an organisation. So I've been very heavily reliant on my network and the advice of, friendly, people I knew and people who I didn't know, and was always impressed and surprised and blown away. And I continue to be today to the generosity of people to share their experience in getting going. So that was how I arrived at the starting line for Sanfilippo Children's Foundation. And from there, over the last 8 years, we've had a lot of different people come in and out of the team, and we'll talk a bit about that. But Sean, I'm interested to hear from you a bit more about the Mito organisation and the work that you do. And I'm going to disappear and close my door because someone's just started a leaf blower outside.
Okay. So the Mito Foundation, I'll give the context of where we're at right now. So Megan and I are going to touch on some of the evolution of our organisations and who our teams were through those steps. But right now, the organisation is 12 years old. It is an organisation that supports Australians whose lives have been impacted by mitochondrial disease, and it also fundraises to fund research into mitochondrial disease. Our remit is rather broad. We will touch on that a little later on, but in terms of scale, we are around a $6 million a year organisation, so that's our revenue. We have a staff or a team, a staff of 15 people, which equates to about 11 full-time equivalent staff. We have, every year we have to complete the Australian Charities Not-for-Profits Commission annual return, and I always think that our number of volunteers would be like hundreds, literally hundreds, but some of those are quite transactional on some of our events. So we probably have a core team of, I think, a good 20 volunteers, including board members, scientific advisors, medical advisors, community members, etc. And they're people who are giving their knowledge and expertise on a regular basis. And then there's the broader network of people that we'll talk about. But so that's the Mito Foundation. And Megan, as we pan back to you to talk a little about Sanfilippo, I guess now. I'm interested, if you don't mind, to just throw a question to you. You talked about a 3-month gap between when your children were diagnosed and when you started Sanfilippo. What was your motivation? What was it that said, I've got to start a charity?
There were a number of motivations. I guess the biggest one was a friend of mine who, while I was shocked and grieved and all the rest of it, kicked into gear and started to research and read everything she could online. And she's incredibly smart, and she educated herself on the various different therapies. And you know, I'll be forever grateful for her, because she really gave me the boost, the head start, if you like, and presented me with, this is happening. You know, I remember her describing to me, this is what an orphan disease is. This is in the same conversation. This is what gene therapy is. This is what enzyme replacement therapy is. You know, and there's this thing called the Therapeutic Goods Administration. Like, she laid it all out for me. And she was a friend, but also an ex kind of work colleague. And she ended up being the first member of our board, and she continues with us today. Her name's Angeline Wienerman. So from that moment, I guess I was dependent upon her, and continue to be as a part of you know, the board. In terms of our team, and it'll be really interesting to talk a little bit about how we came to actually hire a team, because we began with just me at my kitchen table. And when I think about the kind of development of the foundation, it was me at my kitchen table, then me at a desk in a co-working space, then me at a desk in a co-working space with some other people, and then me in a donated room, which used to be a storeroom in another charities building, and it kind of grew from there. And now the team is 8 bodies, but I think it's about 5 FTE, and I say think because I'm actually not one of those anymore. And we have a fabulous new CEO who's running the Childhood Dementia Initiative. You haven't met Victoria Bowen.
She's running Sanfilippo Children's Foundation. Oh. You're running Childhood Dementia Initiative, in case you'd forgotten.
sorry if Vic's listening, that you've just had an extension to your role. So I'm on the board I'm now board member of Sanfilippo, but it's so wonderful to see this organisation that's come so far and being run by, you know, an incredible team of people. But that team did begin with some amazing people who are still involved today. And I think, you know, one of the things that's interesting, and you touched on it earlier, Sean, around what it is that we do, and that our remits are slightly different. Ours has always been quite narrow, and that has been by intention. So we identified early on that there were actually organisations already out there doing support services. The MPS Society, for example, Sanfilippo is also known as MPS 3. So that group was already providing support services for families of kids with Sanfilippo. And so we thought that the area that we could make the most impact would be in the research space. And we've always focused quite narrowly on funding research into Sanfilippo syndrome. But Sean, your remit is a little bit broader, isn't it?
Yeah, exactly. And it's an interesting one. And I think, Megan, when we look at our shared backgrounds in some of the sort of, business consulting or management consulting area, one of the things you've got to know is what's your strategy, what's your purpose? And we talk a lot about this, don't we? And having clarity of purpose, it helps you, what is it that you're doing, and away you go. And I think it might be fair to say that in the early days of the Mito Foundation, it was, we know there's a problem. There's nowhere to go for this community. Sorry, and that's a sweeping statement. Of course, there were places to go, but there was no dedicated support services or research funding drive for mitochondrial diseases more broadly. There were bits and pieces happening over the place. So interestingly, from my role on the board in day one was to agitate and say, what is it that we're doing? And we set it out. And yes, it's broad. Sometimes I think we try to be too many things to too many people. But fortunately, we've been able, I think, to navigate a balance on that. And so we do provide support services, and it's a range of things, largely focused on informing and empowering members of the mitochondrial disease community, so that they can get the best outcome that they can in terms of navigating the health system, making the appropriate support services and disability services and education services, et cetera, available to them, getting access to those. And then on the research side of things, which is another field in its own right, isn't it, Megan? It's just so broad. Where do you even start with research? And we, one of the themes that we're going to touch on, Megan, through this is, I think that purpose evolves over time, doesn't it? And it's important to make sure that you review it and challenge it and adapt it as you need to, and adjust the team that gets you there, right? And even within our research remits, Mito Foundation has taken a different approach to Sanfilippo Children's Foundation. So the broader remit of Mito Foundation, it is broader. But the question then, Megan, is, well, how do we get to our respective narrow, focused, or rather broad strategy? What was it? How did Sanfilippo do that?
So initially it was having those conversations with all of the various stakeholders that were involved. But I think the overarching, I guess the most important thing is that we revisit the strategy every couple of years as an organisation and as a board, but that we're also consulting the families who have children with Sanfilippo, because ultimately, we're here to deliver outcomes for them. So we need to make sure that what we're focused on is still the most important thing. And I think for families with Sanfilippo, this may change over time, but at the moment there is no effective treatment or intervention or anything like that. There's a lot of stuff in trial, and some of the things in trial are looking really promising, but I think until such time as we actually have therapeutics, it's going to always be, a high need for these families to be supporting research and driving research and enabling it and making it happen. We have changed in terms of how we are funding research, and we've refined our approach to that over the 8 years, and that's obviously involved a range of different people as well. So we'll talk a little bit about that when we're talking about our research teams. But it's about consulting with the families, consulting with the board and our strategic advisors and the scientific advisory groups that we have in place as well.
Yeah, and on that concept, or that point around consultation and review and adaptation is particularly pertinent with Mito Foundation. So when the foundation was started, our chairman's purpose was very clear. It was, number one, find a cure, fund research to find a cure, and then until that cure is found, we'll support families who lives have been impacted by mitochondrial disease. Now, mind you, when the foundation was started, the list of names we had of Australians whose lives have been impacted by mitochondrial disease was literally on a sheet of paper, handwritten, and it was 15 people or something. So we didn't know that many. And that is sometimes the extent that some rare disease groups get to, in that they're ultra rare. Now, the mitochondrial disease is not that rare. One in 5,000 children born will develop a life-threatening form of mitochondrial disease in their lifetime. So, so that purpose and that vision and that clarity of purpose was good. But after a few years, we made many more connections with Australians who were living with or being impacted by mitochondrial disease. And I think it was around 5 years after we started that agitation from within the community drove us to flip our priorities around. And now and that was an intentional thing, because we knew more people, and the research game is the longer term, it's a longer road. But we were challenged to say, what are we doing for people whose lives are impacted today by mitochondrial disease? So now our purpose is to support Australians living with mitochondrial disease and contribute to this broader global effort to drive research into mitochondrial disease. So we did that. We challenged it, and we were looking at it all the time, and we absolutely flipped our purpose around. And that was influenced by our team, because our team included the stakeholders, as you call them, Megan, of people who had been impacted, as well as experts, etc. That was just one thing I wanted to highlight around an example there of bringing that up. But Megan, when you got started, one of the other glaring differences between Sanfilippo Children's Foundation and Mito Foundation is the construct of our boards and the governance. So you want to talk a little bit about the governance of Sanfilippo?
Yeah, we began very lean with the minimum of 3, which we needed in terms of our kind of constitution and the requirements for the ACNC and the AICD. And we've taken the approach of remaining lean throughout the last 8 years. And there's a couple of different reasons that we wanted to do that. One was we wanted to make sure that we had this sort of startup agility. Oh gosh, agile, it's a bit of a buzzword, but we wanted to, what's that?
Ready to adapt and pivot.
Yes, and pivot. Yeah. But we had a team who had a very consistent, I guess, level of risk. We had a relatively high risk appetite amongst our board members. Within we managed well and we governed well, but we do have a relatively high level of risk, and understood within that board the urgency of what we were doing and the importance to remain agile and to be able to move quickly. And so we have, through the years, added and had people come in and out of our board, but our board today is still only 4. We are actually at the point where we would like to expand that a little bit more, probably out to about 6 or so, but we don't see that that's going to be, a very big board for all of the reasons that we originally began with, because one of the conscious decisions that the board has made in one of our strategic reviews, or our most recent strategic review, was that we wanted to maintain the urgency. We wanted to maintain the culture of a startup, or and keeping things moving forward. So, but we do recognise there are skills that we probably need to bring into our board, or that we need to have more than one person on the board with that skill. So and that we also, it's important to note, we don't have anybody on our board whose core skills aren't managing the hygiene factors of being a director of a company or a charity in this case. So we know we're reliant on the skills and expertise of researchers and academics and clinicians, and we know that we're reliant on the lived experiences of families, but we didn't think bringing them onto the board was the right thing to do, because we didn't want them to kind of then be bogged down in the hygiene and the housekeeping and the, looking at financials and doing, those sorts of things. So whenever we identified somebody who we thought, actually, we'd love this person on our team, we had a board member who used to always say to me, do you need them on the board, or do you just need them? And if we just needed them, we would think about what's the best way for them of engaging. And he was actually a great example, because he was incredibly strategic great with, you know, direction and where we're going, but he hated turning up and having to go through financials and all of the details. So in the end, he actually stepped off the official board and is still, you know, connected with us for his strategic expertise. So, so I know that's slightly different to the boards of other organisations in our space. So interested to hear about your board, Sean, and how that may have developed over the years.
Yeah, so I think that our Doug Lingard, our chairman and founder, is responsible for the construct of the board. And Doug really used the position of a director of the foundation as a means to engage people in the cause. It is comprised of people with lived experience, but there's only 4 of us who have some form of lived experience. Now, let me say that our board is 13 people, not 4 or 5 or 6. So about a quarter of us have some direct lived experience. There are 4 people who are clinicians and or clinician researchers. Sorry, researchers or clinician researchers. And then there are the rest of the board are really not directly impacted, people who have not been directly impacted by mitochondrial disease in their lives, and typically have been engaged to, their role on the board is to provide a certain expertise. So it is a big board, and yes, sometimes when we're presenting financials, you see the eyes glaze over on a proportion of the board. And so, yeah, look, right or wrong, that's the approach that has been taken by the Mito Foundation, and you know, it's worked to date. So
and I guess that's it, isn't it? Like, we have different remits, we have different approaches to governance, but you know, it's not one size fits all. Everybody's going to need to do whatever's right for their organisation. And the other thing that we're slightly different on is how we engage with our scientific experts. So we have a scientific advisory board that are utilised probably maybe 2 or 3 times a year. They help us set our research strategy, and then they help us select projects that we're going to fund. We've got a competitive grant program that we've implemented, and they participate in that. And I always laugh when I hear about when I hear you quote your advisory group, because you call them the SMAC, right? SMAC. Oh, I've been hearing that wrong.
Yeah, look, and similarly, right? So we have a scientific medical advisory panel, and some of whom are on the board, but there are others who are not part of our actual board. And it's the board that will ultimately make decisions around allocations of research funding. So we have to manage those conflicts of interest, obviously, in and out. And then sometimes so in terms of our progression, and I'm not sure if I'm going off piece here, Megan, but we're just going to go with it. Over the years, we've evolved our advisory panel as well, because what we found is that we wanted Australia's best experts in mitochondrial disease to be advising the foundation, but we also want them to actually be able to apply for research funding from the foundation. And so we had an inherent conflict of interest there. So we've augmented our scientific medical advisory group to include some independent and largely overseas-based scientific advisors who can conduct that review of applications for funding from the foundation, and thus freeing our trusted and local experts and freeing them from that conflict of interest so that they were able to apply for funding. So so that's an example of us evolving our team over that period to accommodate that shift in what we were aiming to do. What other groups do you have advising or supporting, apart from board, and then you've got your scientific medical advisors? Megan, do you have any other formal groups or teams of people?
We don't currently have a patient advisory group, but we do have a team member who's responsible for liaising with the patients. I don't know if I really enjoy that term, but with the families of children affected by Sanfilippo, because we want to make sure that every decision we make and whether that's a strategic decision or a sort of day-to-day operational decision is made with the voice and the perspective of the families in place. So I feel like that may evolve over time, that we may end up with an advisory group, but at the moment we've got, obviously a network of families that we can call on when we need input to things, including reviewing the projects that we're going to fund and having input to that. But
so you're just doing that on a sort of ad hoc basis or as needed, is that right?
Ad hoc when opportunities come along, if we've got an opportunity to participate in a consultation, or we want to get input on something from a family perspective, or to review our projects before we do the final approval for funding. So.
Yeah, and on that note, Mito Foundation formally established a Mito Community Advisory Panel, MCAP. We've got an acronym for everything, and we didn't do that until about 7 or so, maybe 5 years after we were existing. Because prior to that, I think we had people more engaged, volunteering, sort of on the day-to-day stuff, and that was inherently getting that feedback. And then we figured as we grew and had more staff who didn't necessarily come from having a lived experience, that we needed to ensure there was that input from the community around those sorts of matters, and driving strategy, reviewing priorities, that sort of thing. What other groups do you have? How did you do your, obviously both of us, Megan, not coming from a fundraising background. And one of the first things a charity or gets established is you need some money. How did you make a start with that?
Again, we was me, and I kind of made it up as I went along, but with input from people, I was introduced to along the way, and they did include some really fantastic fundraising experts who I've maintained a kind of relationship with on an ongoing basis. But it was actually quite some time before we started to bring people onto the team formally. And that was a really quite difficult thing to do retrospectively, because it is, the money that we were raising was so difficult to get, and we were running everything on a shoestring. But it did get to the point where I realised, okay, this is well and good. We've brought in a little bit of money in our first year, but if we really want to get the outcomes that we need for our community, we are going to have to scale, and we're going to have to invest in our own team. And I think that for any newly started charity is a tipping point.
And it's a tough call, right? It's a tough call.
So hard. And I can remember I actually hired somebody before I hired myself. I was working as a volunteer for the first 2 years. And when I got to that point where I realised I needed someone to run the organisation ongoing, and I also needed income, and should it be me? I was really torn, because I was like, I'm having, my friends are coming and doing sausage sizzles to raise money for the foundation, and we're going to spend it on salary. But, I think that was an absolutely critical thing for us to do. And if we hadn't done that, we would never have been able to scale. But it is hard to do initially. And we'll talk a little bit about the new initiative and things we're doing differently, but that is certainly one of the things that I'm doing differently this time around. It's actually really lovely to get an opportunity to do it all again. And that's one of the things I'm doing differently this time around, is investing in team upfront. Obviously, we're always reliant and appreciative of volunteers and pro bono support. And we still, to this day, we have a lot of professional services, our legal, our audit, etc., that's pro bono to the Sanfilippo Children's Foundation. And so that will always be we'll try that first. But the investment in the team was really critical. And did you find that as well, in terms of when you moved from a voluntary-led organisation to an actual, team?
Yeah, absolutely. And I think similar to the decision process you talked about there, that tough call to take that risk and pay someone to do something. In the case of Mito Foundation, the board decided that was me, and I was, in a position where I could squeeze in, and it was 1 day a week, I think it was initially, and then after a while, I found that was just keeping things going. All I was doing was compliance. I think everyone went, great, we've got staff now, and everything goes to that. And I was writing checks and filling out audit forms and all that sort of stuff at a day a week. So then that tougher decision was, who do we employ next? And And we made the call that we were looking at it and we thought, oh, now, the context of it at the time was we had a fabulous volunteer providing frontline support. So that was amazing. So our first decision was to employ a fundraiser. So we made that, and the board supported it, that commercial approach. If this is going to work, you've got to invest to get the organisation sustainable. And look, we've had a lot of good fortune along the way, so we were able to quickly develop from that point. But yeah, tough to make that shift from volunteer. It gets pretty serious then, right?
Yeah.
Equally, I mean, Megan, it's hardly glamorous, right? You didn't start off in a high rise with harbour views.
I didn't even end up there.
Right, still waiting. But it's an incremental thing, right? And go forward, you take a couple of steps back, bring a couple of volunteers in, get a staff member, that one doesn't work out, away we go.
Yeah, and one of our first staff members, I think she may have been second or third, was our research manager, Chris Elvidge. And we initially started with her as a shared resource with Duchenne Foundation, Duchenne Muscular Dystrophy Foundation, which then merged with Save Our Sons. And so that was a really good way for us to get expertise in just a couple of days a week, and then but share the cost, I guess, of having someone of that caliber working in the rare disease space across two different rare disease organisations. So I think that that's a really good example of how we in the rare disease community can collaborate, in terms and get the whole sector, I guess. And
on that note, Megan, at that point in the organisations where it's starting up, how you and I met was, we were in a position where we were making friends everywhere, right? And we were, because none of us were experts in how to run a charity and how to fundraise and all that. So we put ourselves out there to build our external network, and and this is how we met. You and I met, and we met a number of other people who were in a similar situation. And obviously there was a connection there. We clicked. We got on well, but. Maybe you could just talk a little about what was that like for you at that point? What were you doing?
Yeah, I think it's really hard when you start and you don't have that network of people doing the same thing as you, and you don't have a team, you don't have a peer group. And we actually met through, it's now called Genetic Alliance Australia, which is the New South Wales version of GSNV, and at a leadership group there. And we, as you said, have met a lot of other people through there. And I think organisations like those, and those that are in the GARD Alliance, and also Rare Voices, who do a great summit, are a really good way of building your team of like-minded individuals and making you feel, I guess, less isolated as you're working in similar fields. And you've kind of reflected on this quite a bit in the past, Sean, around the goodwill of our community, and that we don't sort of compete. It's about raising the overall capability of our sector, rather than competing for the dollar or the researcher or whatever it might be.
Absolutely. And that I certainly found it awkward up front, and I don't know your experience, Megan, but the advice I'm given from fundraising experts is that the number one reason people donate is because they are asked for a donation. And similarly, Megan, it's that what I found in this, the amazing generosity of people to give legal support, other advice, talk to other charities who maybe are that a couple of steps up from where you're at, and how many times we've shared, research funding contracts, or working with pharmaceutical industry policies, or that sort of thing. That generosity, like here's one, doesn't. Just sharing it.
Yeah, don't reinvent the wheel if somebody's already done it. Yeah.
It means you've got to put yourself out there, and you've got to ask, right? And that's that broader team that both of us have really we've relied on, of people who are facing a similar experience in their journey with their charities, right? Yeah. Now, Megan, we're doing so well. We're rattling through here. We've got so much to cover off. The one thing I think what we might want to do then is, should we talk a little about the key learnings? What have we learned? What are the key things? Because we want to talk a little bit about childhood dementia as well. But
we do.
Megan, you've got a wonderful phrase for how you define one of the biggest key learnings. Can you share that?
Well, I have two phrases. One of them's probably not appropriate for this forum, but one of the phrases that I often use is that we've kissed a lot of frogs. You know, there are a lot of things that we've tried, or that people that we've hit up for donations or help or whatever, we've had a lot of knockbacks. And I think, you know, one of the key learnings from the last 8 years is to just try it, you know, and if you fail, but you learn something from it. And as you've already, you know, alluded to, the just ask. And one of the kind of key learnings that I am still kind of grappling with is, often when you're asking someone for help or a donation or whatever it might be, you're actually not as powerless as you think. You're offering them the opportunity to help you. And there's actually huge benefit to the person that you're asking in doing that. And whether that's, you know, will you fund this particular project, you're giving them an opportunity to make a difference and to change the world.
Yeah.
And so, you know, it's certainly, it's taken me a long time to reframe my thoughts around that.
Yeah. Yeah, interesting.
Yeah. And Sean, I mean, you've had one of the most successful fundraising campaigns I think we've seen in our sector. But I'm interested in that because I've known you over the years, and I know that wasn't an overnight success.
You knew us pre-bloody long walk, yeah. The overnight success that it was. Well, look, spot on. So we had a series of failed attempts at doing an event that, you know, was based on walking. We took inspiration from our larger sister organisation based out of the US that had what appeared to be a successful community fundraising walking event, and tried, failed. And, you know, we were at the stage where we were probably about four years old, and we tried our first event, and there were about 100 people who turned up, and I think 50 of them were direct contacts of our chairman, 50 of them were direct contacts of me and my family. And I think we raised the sum total of $180, and we were just, you know, work that went into it. Anyway, so we made the call, qualified with having some financial capacity to invest, a board that was willing to invest and take the risk, and we made the call to have a crack, and we at this big walk. But what we realized, and the thing we called out, was we didn't have the experience to do that. We weren't the right people. And so we looked at our team, and we looked at getting in the experts to help us do it. And we found an event manager, someone who knew how to do council permits and close roads and do all that sort of thing. And then we also found somebody who could market at such an event. And so while we went in with our intent, or the preparedness to break even after the first year, we made a reasonable profit. And then the project manager in me thought, okay, great, we'll just do it better next year. And so we made about $100,000 profit in the first year, which blew our minds away. So I'm exhausted, and I go to our chairman and said, oh, it's great, we'll just do it better next year. Maybe we'll make $200,000. And he said, no, you're going to do 4 events next year, not 1, and you're going to make a whole lot more. And so I peeled myself up off the floor. And in the end, we did 3 events, and we, you know, it's gone on. It grew quickly, and we raised $500,000 profit in the second year. Pre-COVID, we were planning on doing 11 events and targeting $4 million in profit. Obviously, that took a significant hit last year. We're trying to bounce back a little now, but that willingness to invest, take the risk, having capacity to do so up front, plus engaging the appropriate expertise, was probably the key to that success. And made a lot of mistakes along the way, and keep going, you know. Yeah. Now we're glorified event managers. Now, Megan, what about one of my other key learning, and is that you can't please everybody, inevitably. And I'm not saying we're closed-minded about or disregarding people's perceptions, but inevitably we're not everything to everyone, are we? And we're never going to be able to please everybody along the way, right? But you've got to be able to just pick yourself up and keep going.
Yeah. Yep, absolutely. And keep going, we are. And
yes.
And now we're actually formally part of the same team in the Childhood Dementia Initiative. So this is the new organisation that we've launched towards the end of last year. And this was born out of real collaboration across our sector and the years of working and seeing other organisations working in the same space and seeing researchers working on the same problems but for different disorders, and recognising a really big opportunity to bring together what we're doing for the individual disorders into an umbrella organisation. And what the initiative is really reframing the way we think about the disorders that affect kids that result in dementia. And we undertook a study last year, and when we speak about team, we had an incredible member join our team who was a health economist who did a burden of disease study for us on a pro bono basis, and I will be eternally in his debt, I'm sure. And the findings of that were really very significant. And so much so that we've decided that there is opportunity to really transform not only the way research is done into the rare disorders that present with dementia, but also in how clinical care is delivered to families who have a child with dementia. And so I would love for, to talk about the Childhood Dementia Initiative for another hour, but we're going to run out of time. So just to kind of reflect, I suppose, I mentioned earlier, one of the really fantastic things about starting a second organisation is that you get to learn from the first. And the key things that I've learned all come back to team and who's on the team. And I guess the primary one is that early investment in good people. Because if we're going to make this happen and we're going to have the impact that we want to have, it needs to have a good team behind it. We have a fantastic but very, at this stage, small board, and that includes Sean. So that's hence we are formally team members because some of the mitochondrial disorders actually do present in childhood dementia as well. The other thing that we're doing differently is around government, and government is also an important member of team. And it took me quite a while in the Sanfilippo journey to, I guess, understand that and also have the confidence or the understanding of how to engage with government. And I still don't really know how a lot of it works. And so I've brought into our team at Childhood Dementia an expert who's helping us with that engagement. They're a third party that we've hired, and they are guiding us in the best way to engage with government so that we feel like we kind of have one shot and that we're doing it properly. And then the final thing is probably around having that clarity of not just purpose, but business plan and strategy and the key steps that we're going to take. So, at this point, we've been an organisation live for about 4 months, and we already have a 2-year business plan. We have a 2-year strategic plan. We've got all of the wheels in motion in terms of the key programs that we'll be undertaking over the next 12 months. So. Yeah,
Megan, I think you've summarised it perfectly. I don't think there's much more to add other than, to recap what you've said there. It's about, and in the Childhood Dementia Initiative world, it's about clarity of purpose. It's bringing in the right people to do the right job, because we can't do it all ourselves. We can't be that broad, can we? Yeah. So I think that hits it on the head.
Yes, it does. And I think Monica is going to open up for questions. She's got to find her mute button first.
So Megan, while Monica's waiting, I've got a question for you. How about that? So you've been through it once successfully. We're having another crack right now. So you've talked about what you're doing differently, and that's great. So what would be, if there are some organisations out there that are representing families or children who have childhood dementia, or one of the types of childhood dementia. What would the call be to those organisations or people from those organisations?
Yeah, we're really keen to collaborate with the organisations that exist representing children with dementia, and Sanfilippo is a really great example. They're continuing, we are continuing with that organisation because there are things that are specific to that individual disorder that are always going to need representation. So this new initiative is in no way replacing the good work that happens by those organisations, or duplicating. In fact, absolutely. What we're about is raising the profile of these conditions, advocating for funding, more funding to come into this space, not directly to us necessarily, but to the researchers working in this space. We want to raise the profile of the problem that is childhood dementia and the solutions that need to happen. And we've got some really great working relationships with some of the patient groups that represent kids with dementia already, but we would love to hear from any others. We're also building a consumer network that makes sure that we have a group of people who understand intimately what it's like to live with a child with dementia, so that we can contribute to public consultations and, you know, really get the kind of word out around these conditions.
So thank you so much. You guys can hear me now, yeah?
Okay.
As apart from see the panic on my face when I can't find the mute button. You've got to love. We should be good at it by now, shouldn't we?
It's not a Zoom meeting unless someone's muted and talking, right?
Exactly. Firstly, I just want to echo the thoughts of people in the chat and private messaging to say that you two are both incredible, and I just want you guys to be quiet for 1 second and just hear there is applause happening around the country for your work, for your dedication, your commitment to your communities and your successes, but most of all, from your want to share. It's one thing doing amazing work. It's another thing holding your arms open and saying, come with me on the journey and learn from me, share with me, be part of the team and the journey. And you guys you do that every day. And, you know, you support us and we support you. So I love that. And thank you.
It's a love fest, Monica, because, you know, I think we could say the same to you, you know, because it really is groups like GSNV and others around it, you know, particularly those who are members of the Guide Alliance. From our point of view is when we started out with just deers in the headlights, and, you know, to know there were places to go to get some good sage advice and support was phenomenal. So it's a love-in, Monica.
Well, if that's what it takes to get collaboration, then let's go. But we do have some questions that we should get to. And one that I would just like to start with, we've got some specific ones, but one question is to each of you, what are you most proud of?
Oh, I'm proud of, I guess, the team that we have now and the difference that we're making, and that we gave it a go. You know, that we got in, saw a problem, and gave it a go.
Oh yeah, and I don't know that I could ever try to answer that one. There's so many things that I think, to continue on from what Megan said, is that we're there, we're having a crack, and look, we've had some great successes. An example that really resonates, and I remember because I have a short-term memory, is recently, so mitochondrial disease, very few people have heard of it. But recently, as part of our advocacy program, there's some attention being given to mitochondrial disease with the Federal Department of Health. And there is an email address now, mito@health.gov.au. And I got tingles when I saw that. I think it was quite amazing. And I think that's obviously representative of a whole lot more, but that was a little indication. So I think raising the profile of mitochondrial disease has been one of the key areas of being proud.
Well, and so you should be. I think that you've kissed a few frogs and you keep turning up. That's the message that I'm seeing there. So in terms of keep turning up, we've got a question about how you actually grow your reach of stakeholders, how you actually begin with a few people and expand that network out, and particularly then capture people who will do things pro bono for you. And an extension of that as well, sorry, I'm making this question more complex, but I'd also like to understand how you use, in the nicest possible way, that network and ensure they don't get burnt out along the way.
You want to crack at that first, Megan? I've got some ideas on burnout.
Have you? Yeah. I mean, how you find them, I guess I utilise my network initially and talk to people and put out there what it is that we're looking for. But there's also some good forums that you can go, Pro Bono Australia, I think, and some other forums, some of the corporates, KPMG and EY, and some of the big corporates also have pro bono functions that you can link into. But I guess it comes back to that, just ask. We have an auditor who's been working with us for 8 years, auditing our accounts pro bono, and we actually hired him via a LinkedIn ad. So LinkedIn, I don't know, they approached us and said, hey, would you like a free ad? And we went, yeah, all right. And so we put an ad up, and this guy applied. And well, actually, lots of people applied.
Wow.
We were very clear that it was a voluntary position, but lots of people applied. And we found this particular firm, and they've been doing our audit for us for 8 years. So I think it's just putting it out into the universe and being prepared to ask and have that answer ready when someone says, what is it you need? Yeah. The burnout,
it's always there, right, Megan? Yeah. Because you get it with, particularly I find you get it with volunteers, because typically our experience is the volunteers are those people who are living with mitochondrial disease in some form or another, and inevitably their lives are complicated more than an average person whose lives are not affected by a rare disease, and so their lives are typically more full. And how they manage to squeeze things in is regularly really impressive. But burnout is a thing, and we find volunteers come and go, and they probably have a cycle of a couple of years, and on average, I would think would be fair. And that's probably what Mito Foundation saw. We're purely voluntarily run for the first 2 to 3 years, and everybody was really happy the day that we had some staff. So but just put yourself out there and ask, I think, would be the key.
Yeah.
Okay, thank you. That's great advice for each of us. Just don't be afraid to ask.
And you're going to get a no more often than not, or an awkward, I'll get back to you.
Well, I guess if you don't ask, though, you'll never know, will you? What about those the experts that we need to collect along the way, like people in health areas, in education? How do we bring them onto our teams? How have you guys done that?
I guess the first person we brought as an expert into our team was when I was thinking of starting the foundation, and I just saw a name that constantly popped up in all the academic papers. And so I basically found him, stalked him, and he happened to be an Australian, which was really, really lucky. And I called him. I remember actually, I emailed him, and I thought, I was really nervous. And he called me within 10 minutes, and he was then on the team until he eventually retired. So I think once you kind of get going and are researching your particular condition or looking at what's happening in the research space, there'll be names that continuously come up, and just don't be shy. I mean, I'm overwhelmed by, how open, and I don't know if it's just in the rare space or if this is across the board, but how open clinicians, they're incredibly busy, but they're open to talk to you, and researchers are open to talk to you, and really, happy that we're doing the work that we're doing. So I think you come to know who the people are, and you stalk them.
But you're right, spot on, Megan. The generosity of these experts, it always impresses me. We were part of a collaborative effort to apply for some funding recently, and so we've got all these people putting together this application, and we tried to guesstimate the amount of volunteer hours that they'd put in collectively, and it would be thousands on top of their jobs. It would be thousands among a group of sort of 5 or 6 people, thousands and thousands of hours, board meetings, scientific advisory meetings, expert panel reviews, the ad hoc questions about this paper, and they give you a 1-hour response. But it is phenomenal. The generosity spirit is phenomenal. And I think if you look at probably part of the reason they're in the field, right, is because they're passionate about it. They're not, they could probably go, these super smart, impressive people could probably go and make trillions of dollars elsewhere, but they've had a calling, I guess. And so, yeah, just ask. And
the other theme I think was really common in both of your presentations was that evolution. Like both your organisations and ours too have changed in sometimes more quickly than others, but still there's that evolution and the need to take a step back and a breath and say, who else do we need here? Is it the right direction? And is that something that Megan, you mentioned you've got a 2-year plan. Is that kind of the breadth of time that you think we need in our sector? Is it a 2-year? Is it what do you think?
Yeah, I mean, we've got a 2-year strategic plan. And then under that, we've got, or when I say we, this is Sanfilippo, business plans to enable that strategic plan. But we review that quarterly and things change. I mean, last year was a classic example. And actually, the team, we reflected at the end of last year when Vic joined us, we had an offsite with our guys and looked at what are all the things that we've achieved this year. And it was a crazy year for everybody with COVID, but having had that plan in place, that rigorous plan in place, really allowed us to continue to move forward. So we review that quarterly and identify, well, what's not moving forward? Why is it not moving forward? Is it not moving forward because it's not important, or is there something else that's holding it up? And if it's not important, then we need to tweak and bring in the thing that is important. So I think it's that constant review. So whilst we set the strategic at the board level, we set our strategy in place for 2 years. Certainly the execution of that is being monitored and reported on a quarterly basis.
Great, thanks, Megan. Sean, have you got a time frame?
Yeah, so we have a 5-year strategic plan. I think it's a little long. It's certainly, we're at the end of our 5-year plan. It's pretty stale at the moment, but we do, in practice, we're probably more disaligned with that plan, and we realised some of those things we called out 5 years ago just unrealistic. So I think it's a balance of having a longer term direction, and maybe it's more of a goals or vision type of scenario, and then shorter term planning, or so we formally adapt our sort of 12-month plan. We will have a plan and budget on a 12-month scale, and even with that, as we saw last year, it was just chaos. It was weekly, daily. So,
yeah.
Hopefully last year was the anomaly in this kind of
But you got good at being agile, didn't you, Sean? I can remember you saying, like, the minute you've reforecast something, you have to start again.
Totally, yeah.
And just one last question for you both. How did you actually, in the beginning, and you're probably still doing it, but how did you find your community of lived experience? How did you go about it?
I can jump in on that first, Megan. So the mitochondrial disease community is larger than a lot of others in the rare disease space. And so for us, it was a combination of finding the clinicians, finding out where the patients were. And it was through the clinicians and the clinics. And so we targeted some of our support service programs through the clinics. So we would host information days in person at various places around Australia. Now, we couldn't do that from day one, so we started where we were, happened to be in Sydney, and then we've extended from there, but also establishing an online presence, and we use Facebook. When we started, it was still the term online forum was still being used, and I'd suggested, because I'm such a social media entrepreneur, that we should just use Facebook, and so A, it's free, B, it's done. And so we so it was a combination of sort of going out there digitally and having a way for people to find us, and then finding where the community members were. And that's been successful for us.
Yeah.
Megan?
Yeah. I often wonder how different the outcome for the organisation would be, but also my life as a parent of two children with this condition would be if it was 10, 15 years ago, and I didn't just have at my fingertips a community of people, that we do. When we first started, there were some people had set up internationally, mostly in America, those web forum things that we used to have, and they've all been abandoned now for Facebook. So, it was funny in the last week or so with all this stuff going on with Facebook, I started to get really nervous, Facebook is so integral to everything that we do. But I think, it is, whatever you think of it as social media, it's such an enabler for families to find each other and to share experience. And, we've definitely, benefited from that. And now that the Sanfilippo Children's Foundation is well established, we find new diagnosed families will often contact us fairly early in their process. And whilst we don't provide support, we do try to make sure that they meet other people within their area and that kind of thing. For the Childhood Dementia Initiative, we're really just starting that process again and trying to find our community. And one of the challenges in that, which is quite interesting, is that not everybody within our community will identify yet with dementia. And in fact, I didn't identify that my kids had dementia until probably maybe 3 years ago, and they were diagnosed 8 years ago. So we've got a very kind of big piece of work there in kind of changing the way that we talk about the childhood dementia disorders.
And as you do that, you will change the people that you need on your team to deliver the outcomes that you want. Thank you so much for your generosity and time and your honest stories about your lives, as well as your stories about your organisations. Thank you. I'm sure we will be working together in the future, but our broad community is so grateful to have had you along. So we will.
Thank you so much.
Absolute pleasure, Monica. It is really a privilege to be part of this broader community. So, and thank you to you and your team for all the work you do.
Well, happy Rare Disease Day for Sunday. Yes. Do something nice.
Excellent. Thank you.
Thank you. So it's time again for a break. We're going to take 10 minutes and then we're going to come back with our wonderful 2 Ps in a pod ladies who will talk about their team, and I'll tell you a bit more about them when we come back. So we've got 10 minutes, which is plenty of time for you guys out there to make your videos. So you go away and do that, and I'll see you in 10 minutes. Thanks.
Hi there. Something interesting about my genes is that my dad was Irish, so I get sunburnt really easily, so I have to be really careful of skin cancers. And I'm probably a little bit more susceptible to being overweight because a lot of my dad's family were overweight. Probably also eat too many donuts.
Hello, and welcome back. And welcome to the final session of our Rare Disease Day event today. And we are absolutely delighted to have 2 amazing ladies with us, Kate and Mandy, who are PFASs, and I'll let them explain to you all about that, from 2 Ps in a podcast. And Kate and Mandy are proud, in their own words too, this is not mediocre mums with amazing twins with multiple disabilities and additional needs. They were also nominated this year for Australians of the Year. So, and I'm sure you will know why that's the case after we hear from them. It's wonderful to have you ladies with us this morning, and we're looking forward to hearing from you. Thank you. We should be able to hear you now, Mandy and Kate.
Oh, hi.
Hello.
The joy joys of Zoom. We weren't sure if the PowerPoint was going to start, and then we were going to talk. So should we just launch into the PowerPoint?
Go for it. Knock yourselves out.
Okay.
Okay. Oh my goodness.
All right. So while we're waiting for that, Mandy and I, here we go.
Welcome back. They say laughter is the best medicine, and when it's mixed with a healthy dose of shared experience and brutal honesty, it's a prescription for a very popular and uplifting podcast. You can just ask Mandy Hose and Kate Jones. The Melbourne mums started 2 Peas in a podcast 12 months ago, and they talk about the joys and heartaches of parenting multiple children with disabilities.
Today, they have more than 1 million listeners who tune in as they laugh, cry and share the candid truths about their, at times, chaotic households. And we're thrilled to say that Mandy and Kate join us now together from Melbourne, together under the same roof for the first time in months, ladies. It's a sweet, sweet day in Melbourne. Look, despite having 8 children between you, 4 with disabilities, daytime jobs, and this wildly successful podcast by night, you both seem to be full of beans and energy, and I think that's what makes you so engaging on the podcast as well. How do you keep all the balls in the air every day?
Look, we don't. That's true. And that's okay, because it's a myth that women keep all the balls in the air. But we drop a couple and we drink a lot of Diet Coke and Coke Zero.
Good secrets there. Mandy, you and Kate both have twins with disabilities and additional needs. You started the podcast as a way of sort of connecting with other parents in your situation. So how important has that connection been to connect with people in the same boat as you?
It's been life-changing for us and just so enjoyable to just really talk about what's sometimes a group in the multiple birth community that people aren't talking about. And we just thought, we want to tell the stories of our families and our twins. And, yeah, look at the photos of my girls. You know, they were born 9 weeks premature. Kate's were prem as well. They're stories we want to tell the world about.
Kate Jones and Amanda Hose, hosts of 2 Peas in a podcast. Kate and Amanda met 14 years ago after both having twins with a physical or intellectual disability or additional needs. They started their podcast after realising there were few voices speaking about their experience. In 12 months, their podcast passed the 1 million download mark, attracting an average of 10,000 weekly listeners. By sharing their parenting experiences with humour and honesty, Kate and Amanda give a voice to parents with children who have additional needs.
Hi, Mandy.
Hi, Kate.
We're back.
We're back in the pod bar.
Back in the pod bar.
Meet Kate and Mandy.
This podcast contains truth, laughter, and the occasional F word. Yes. It's not suitable for children. Put your earbuds in, friends.
Both working mums with children, Kate and Mandy realised there was a distinct lack of voices talking about the joys and difficulty of raising kids with additional needs. So they began 2 Peas in a podcast.
Our podcast is 2 mums who have multiple children who have additional needs and disabilities.
We met because we both had twins in the same year.
Yeah, we did.
And we were finding each other and finding our people that understood a little bit about what we were going through.
Yep, we made it for you because we couldn't find an Australian voice.
That's right.
And the response has been overwhelming. Since debuting their first episode in May last year, Kate and Mandy said they'd be happy with a handful of listeners, but people were on board right from the get-go.
We thought, why don't we give it a go?
400,000 downloads now, so we get about 10,000 people a week.
It's a winning formula that's helping families, or as they call them, their P-tribe, navigate parenthood in all its ups and downs.
Please welcome Kate and Mandy.
Well, we are so glad to be here with you today. We wish we were there with you.
Yeah, we could have some afternoon tea or some lunch together.
Yeah.
But here we are in the Zoom in Kate's house, and we're so thankful to be here. Thank you for having us.
Honoured,
Yeah.
very honoured. We love Heather from Swan.
Yeah.
And I know she sort of got us in with your gang.
Yeah.
So thank you so much for asking us. So we thought we'd explain a little bit about ourselves, and to do that we might ask you some questions which you probably can't reply unless you want to do in the chat, as we can see those.
Yeah.
First question is, I'm assuming that some of you might have finished year 12. Maybe, yeah.
You can put up your hand.
You can put up your hand, you can give yourself a little pat, or, you know, yes, we've got some yeses.
Yes,
all right,
okay, great.
You might have some people who've done maybe a certificate 4. Might, I know,
Yes.
yep. Maybe a diploma. 2 diplomas here, baby.
Yep.
Maybe a degree. Maybe a few Bachelor of Sciences sitting in there. Yeah,
Oh my
yep.
God.
She's winning.
Yeah.
Maybe even a master's.
Master's.
We might have some masters.
Oh, yeah. Yep,
Maybe a PhD even sitting in there.
Oh, bye-bye, Monica.
Sorry.
Okay,
But we have got something that none of you have.
We've got our robes on.
We've got our graduate robes, because we
are PFESs.
We're PFESs. So it's taken us about 15 and a half years.
15 and a half years to get our PFESsership.
Yes.
And we feel like we earned it.
We have earned it. And sadly, most of you will never get the chance. So it's a really exclusive club.
Yes, it is.
You know, and really our degrees can also double as birth certificates.
Yes.
So, you know, we have got them up on the wall to
Yes,
prove
we
that we
do.
did earn this.
Yes, that
Really.
we have learnt the most in our lives from parenting our children.
We really have.
We really have.
It's changed everything about us.
Yes.
And a lot of other people we've discovered. So
Yes.
we started our little podcast in May 2019 on Mother's Day.
We did, actually.
Yeah, it was on Mother's Day. So we're coming up to our anniversary in a couple of months.
So we just thought we'll give it a go and maybe we'll get 30 listeners. We were sure some of our friends would listen, they'd feel sorry for us, or our family.
Because we had no idea what we were doing.
No, and we just luckily had Kate's son, who is our sound engineer. So he was like, no, we're going to do this properly. And we're like, let's just do it
So
on
we're
the
going to do
phones.
it on our phone. And he made us get microphones.
Yeah, and we love podcasts. We listened to
Oh.
them for years, and
Yeah.
I just and the ones that stood out to me were the truth-telling podcasts. And I just thought, we've got to tell these stories about diversity.
Yes, and there was no Australian voice. So there's a
No.
few American ones.
Yeah.
And they were a bit too mom for
Yes,
us.
that's
so
right.
we thought we'd bring the mum into the podcasting world.
Yeah.
And the thing that Mandy and I had in common was also something that set us not in common. So our children have different disabilities and additional needs. So we were really good friends, and we would sit in our car after dinner when all the other multiple birth mums went home, and we would cry and laugh and talk. And Mandy had her little community, which she didn't quite fit in either.
No.
And I had my little community, which I didn't quite fit in. And we realized we wanted to be in the same community.
Yeah.
We wanted to build a tribe.
Yeah.
So
we tried, and we have.
And so actually you can.
Yes.
This is what has amazed 2 middle-aged women with a diploma.
Yes.
You can build a tribe.
Anyone can. And so we had to name our podcast, and that was tricky. So I just put in like a message to all my friends with kids with all sorts of different disabilities.
With kids with disabilities.
Yeah,
you've got your message group on Facebook.
Yeah, so I just went straight to them. Maybe there was like 40 people, and I was like, we're going to do this. What should we call it? And then we just got so many names in. And but eventually the person that named the podcast was our pediatrician.
It was the pediatrician. So I say we share a pediatrician, but I think it's our children's pediatrician.
We have been seeing him for 15 years.
Yeah, sometimes he feels like he's our doctor too.
That's right.
And I said to him, Mandy and I are going to start a podcast. And he's like, yes, you are. And you're going to call it 2 Ps in a podcast. Just like that. And I was like, of course.
Of course. And then I said, yeah, we're going to do that. And then we looked, and there was already like 15 2 Ps in a podcast.
Apparently it's a good name.
So we changed it to TOO because we thought then that will mean us too.
Yep, P2.
P2. So everybody can feel like they're part of ours. So some people say we are the bogan name of the podcasting world, but that's okay because it has a meaning to us.
It really does. And also it promotes a lot of conversation.
Yes.
Just like living with different disabilities. People
he's like, why did you call it that? And then we get to tell him this whole big long story.
That's right.
And it's actually a really engaging thing, the name of our podcast. And what happened was we didn't just speak to people whose kids went neurotypical. We didn't just speak to children who had rare or undiagnosed diseases. We didn't just speak to people whose kids had cerebral palsy or adults living with these. All of us came together.
Yeah.
And it's like the best parents group in the world. I can't even tell you. It's changed our life.
It has.
And we've realized that tricky things are tricky, but they're not bad.
Yeah.
That if you've got a friend whose child has a life-ending condition, it's really, really sad, and it's okay to just sit with them and be with them.
Yeah.
And they've come into our group too, and we would never have been able to make friends with those people, and they've made our lives richer. So when we found the topic of today was about growing your tribe, that's all we've done.
And I think for me, my children have a hemiplegia cerebral palsy, and in that spectrum of CP, I just couldn't find my people. I just couldn't find them. And so I felt very, very lonely. And you know that feeling of walking the halls at the hospitals or going to constant therapies and just thinking, I don't fit in anywhere. And so just having that lived experience, the authenticity of our podcast, people trust us. They know we've gone through hard stuff. They know our children live with tricky stuff. So I hope that shines through.
And I hope that if some of you haven't listened to our podcast, I mean, if you're not into podcasts, that's okay. But you can listen because everyone's welcome.
Yeah.
And that's a really, really cool thing. So hopefully you can hop on board with us. And we've got a lovely, lovely community. But we didn't know how to build a community either. Like we knew how to talk.
Yeah.
That's a gift that we were given.
Yes.
So
we both grew up in the church though. And so I think there was a little bit of learning about that sort of comes naturally to the both of us.
Yep.
So that, so I definitely have to give credit to that in growing up in the church and just knowing about how to build community within that small community.
Yeah.
One of the biggest moments was when Annabelle Crabb listened to our podcast. So we listened to Chat 10 Looks 3 and
which is her podcast
with Lee Sales. And I went in, they had Wednesday when you can share your podcast. So I put in, we've just started one, really meekly.
Yes.
And then the day went on and I forgot about it. And I was at netball training and then I saw Annabelle Crabb's replied and she's like, I've just listened to 5 episodes. And I was like crying, what the heck? And then she spoke about it on her podcast and then we got 10,000 downloads that day.
And we had 4,000 downloads before then. So which
Yeah.
we were thinking, we won't swear, our poo didn't smell. That's what we thought. Wow, 4,000 people have listened. We were getting a couple of 300 a week maybe.
Yeah.
And now...
So to go to 10,000, that pushed us up to number 2 on the iTunes chart. And were we watching that all night? I was like,
scrolling.
3, 2, we're going to get to number 1? But no, we could never pip Snowball.
No, Snowball, which you've probably listened, was an awesome podcast.
Anyway, it was a great moment for us. We were like, that'll never happen again, but it was so amazing.
But it opened doors.
Yeah, it did open doors.
And it made people realise that we have more in common than we think we don't.
That's right.
And so Annabelle Crabb, her children are typical. They, probably have the odd tantrum, whatever, but...
Won't read her books.
Yeah, they probably won't. But then she realised, I'm drawn to this community because our community is full of real people.
And we're interesting.
Yes, really interesting.
Yes.
And
we think we are.
Well, not us.
No, but that's right.
All of you.
Yes, our diverse mothering is more interesting than the boring everyday mothering.
It really is.
Because we do that as well.
Yeah, we do.
And so we know.
Yeah, we've got quite the mothering spectrum.
Yeah. So we went to Ozpod last year, the year before, which was run by the ABC. So it was in Melbourne and it was a podcasting day and we just couldn't believe we were there. We were early. We were like the typical 40-year-old women wearing our jeans and our little backpack. And we just
learned famous podcasters
and we were just like, okay, what can we learn from this day? And there was a big discussion about building community.
Yeah.
And so that's when we decided to start the Hangout, which is our private closed group on Facebook. So we started that so that the listeners have a place to belong and also that can engage with us and have access to us, and also that we can all look after each other.
Yes, there's heaps of advice given in there.
Yeah.
It's beautiful. no one's ever done anything horrible. There's none of that internet trolling. We are very strict on who can get in.
Yeah.
And it's just the most divine community. It's changed our listeners' lives and ours.
Yes, it
So
really has.
And from that hangout, we got a beautiful listener called Carly, whose husband sells merch.
Not boobs. I'm doing it.
No, these are mine. So their child lives with undiagnosed syndrome at the moment, and he said he does the merch for all the Australian music industry. She's not interested in any of them. She only cares about the piece.
She only cares about us. So he was like, I'll do this for my wife, because he said, I love my wife, my kids, and merch.
So we're in there with the merch.
We're in. So
all of these, our Eat, Sleep, Hospital, Repeat.
Yeah.
How good is this tote bag?
Yeah, we've also got Eat, Sleep, Therapy, Repeat, stickers. Yeah, we come up with different things all the time.
We keep changing it. And he doesn't charge us.
Yes.
So he just covers his costs, because he's like, I want you girls to keep talking.
Yeah.
Which, it is a little bit expensive running a podcast.
And people have, seen, I was at the Royal Children's today and I saw your P t-shirt, or we've got lanyards, so some doctors wear them,
tiny
little
pins.
So it's just a little way of saying, hi, I'm in the P tribe. So if you see that, then you know they're one of us.
Yeah, and you can go say hi.
Yeah.
So, and then we had this very loose unit. That's what I'm going to call him. His name's Matthew Hardy. He's a Melbourne comedian. You may not have heard of him. He was like on SEN as well. He's a sports guy.
Yeah.
He's a blokey bloke.
Yeah, he is.
Anyway, he listened to us and thought these girls are amazing, which was amazing to us. I thought he was sort of trolling, not trolling, but
Yeah.
Anyway, he said, you guys can do live shows. You guys can do amazing things. You're a huge talent, which I don't think we are. I think we're just people speaking honestly.
Yeah.
And the world didn't have a lot of that.
Yeah.
So we did a little tiny live show in the basement of my
Yeah,
house.
a Christmas show. So we invited all our friends and our family to see whether we could pull it off. And we think we did. So then we went into some planning to do live shows, which was I was like, yeah, we can do that. Yeah, I don't know why I was so confident. But anyway, I just thought, I'm not scared to speak to my people.
No.
Yeah.
Not at all.
So we started doing that. But what I really wanted was that was going to be easy for the women mainly to attend. So I didn't want it to be somewhere that was hard for them to get to. I didn't want it to be at a terrible time. I wanted it to be on a weekend so that people could access their support workers, their family. That was really, really important.
We really gave him a really strict lot of rules that he'd never had before. I was like, it has to be accessible.
Yeah.
It has to be this. It has to be that. It has to be during the day. He's like, no gigs are during the day. We're like, well, this is not a gig.
That's right.
Anyway, sold out.
Yeah.
So 300 people came to Sydney.
Yes.
And then you all know what happened. COVID.
This time last year. So we had our Sydney live show. We went up there and that was awesome. And then we came home and then boom, the world shut down.
so no more live shows.
No, we wanted to do Melbourne shows first, but he was, let's just do Sydney first. It fits in. So that was funny because we went up there and we didn't really know anyone. But
it was amazing. And what we realized by doing that live show, people came from everywhere, interstate. And I thought we had a right to be lonely.
Yeah.
Because other people were lonely. It's not imagined. It's not me just catastrophizing. It's not me going to school drop off and then getting back in my car and crying. There's a lot of us doing that, but we really love our kids and we're really proud of them.
And when we're not lonely, we do a better job of parenting.
So much
so
better.
If that's something that we can do, I mean, it's changed our lives. So
100%.
If we can help that with other people to them feel like they're not so lonely and I'm going to do a better job parenting our precious kids, then that's something I'm really proud of.
So proud of.
And so then we started homeschooling.
Or as some people said, it's not homeschooling unless it's from the homeschooling region of France. It's just sparkling remote learning.
That's
so
right.
We did a lot of remote learning and it wasn't sparkling. Not one drop.
And that first one, I was awesome. I was like, the puzzles are out and I'm getting back to organised Mandy. I had trestle tables out. I was like, we're going to do a great job of this. My children go to 3 different schools and one of my daughters with intellectual disability goes to a special school. So I was like, what are we going to do?
And I'm sure you all, if you are parents listening to this or carers, you went through it.
That's right. So I was like getting support workers in. What was NDIS going to do? How are we going to manage this? Boy.
And all of our Ps felt the same. and we were out of control while having to be in control. So we started recording snap peas.
Yeah.
So every Monday we'd put out an extra episode. It was really for the people that were in lockdown. We'd vent a bit, and then we'd listen to our listeners would send us little messages.
Yes.
And those messages were beautiful.
And they're from all around the world.
Because we were all in the lockdown together,
Yeah,
you know.
in the first one.
Except
Yeah.
in Melbourne. We do it hard in Melbourne. We go harder and better than everybody else.
So we also had to learn about Zoom. Here we are. But we middle-aged women, you know, it's not our, like I
No.
said to Kate, I reckon 2 years ago I lost some of my skills.
Yeah.
So now it's like, oh,
My tech
Zoom.
skills are regressing.
Yeah, but for my house, we had WebEx, Zoom, and Teams.
Yep.
It was just, oh my goodness gracious.
You'll be happy to know that even though, you know, we look so amazing here, we're actually zooming off my wheelie bin.
We're going to take a photo and put it on our Instagram.
We don't really know what we're doing.
No, that's right. So yeah, we got into recording, and that actually opened up recording people from all around the world. So actually that got our butt into gear to do that a bit quicker than having people in the pod bar. So I'm really actually grateful for that bit.
Yeah, that's right.
To get different stories.
Yeah.
And we pride ourselves on getting the everyday parent,
Every day.
or we've got professionals who call themselves professionals. We've had adults with disabilities. We've had so many.
Everybody is welcome.
Yeah, that's right.
So yeah, we don't give any advice. We are not a parenting podcast. We embrace being mediocre. We embrace having days where you cry on the floor, because we have a thing that Mandy coined, the turnaround time. And if you have a child with additional needs, your turnaround time is amazing. You can be bawling your eyes out and then whoop, answering that
I'm
phone.
an expert at it.
So
I remember one day getting a call from the Royal Children's on the Friday and saying she's going to have another surgery on Monday. And then I just lost my mind and I'm crying. And then I had to go and run a sleep talk because that's my work. And I just went in the car with the air conditioner on my face. I was drinking a Coke Zero at 8 a.m. and downing the Boost chocolate. And then I walked in there and I just aced that.
Yeah.
Because I was just, you've just got to keep going.
Yeah. So we were so lucky that we had that. And then all of you came on board with that, all of our listeners. And then the other little thing we'll do before we talk your leg off is we wrote a book.
Yeah.
So we thought, you know lockdown, easy. Remote learning, easy. Talking every day to the teacher's aide, easy. Let's write a book.
Yeah, why not? I mean, I've never written one in my life, but let's do it. Kate got the ball rolling, and then we both wrote it from our bedrooms.
We did. We wrote it with dogs on us, children
September.
on us.
Yeah, and I was writing at the kitchen table, and then I was quickly stirring the bolognese, and I thought, this is our lives.
This is the power of women and mums.
That's right.
That we can do this.
We don't want to perpetuate them, make
it
women
was
more
hard.
busy.
No.
But we're just saying we're awesome.
Yeah, we're awesome.
Well, we're saying, I'm writing the book. I'm writing the book.
We also did start White Wine Wednesday during lockdown. So, you know, we've all got our coping mechanisms. Don't listen to me, doctors.
Right. Yeah.
So,
and the thing that I'm super proud about is that we spoke about children with disabilities and additional needs and how that was affecting them in the lockdowns. And so that is on the record.
Yeah.
So people were ringing in and telling us what the schools were doing, how they were handling it, what was the Victorian government, how were they handling it? Were we giving children back to the special schools earlier? How were the mainstream kids with funding coping? Like, who would ever have spoken about that before? That makes me want to cry. But I just thought we need to speak about our families in the education system, not just the typical kids, because my typical kid was not coping either.
Yes.
But my goodness.
Yeah, it was.
So I'm really proud that that's there and people can listen to that.
Yeah, they can. And we had a lot to do with Association with Children with Disability.
Yeah.
They were awesome. They came on and just told us how to cope and how to cope with going back to school.
Yeah.
Anyway, you've all lived through the lockdown. You don't want to hear anything else about it.
One fun thing is when we came out between the lockdowns in Melbourne, we went onto Dylan Alcott's podcast called Listen Able.
Hopefully you all listen because it's really good. Not our episode.
No,
all of them.
yeah, his podcast. So what a thrill to be able to meet him. And it was great to just go out somewhere.
I know. Anyway, that was short-lived. We went back into lockdown.
Yeah.
So that's okay. You know, we all during this time, writing the book, trying to help our children, trying to keep our little businesses alive, we got a phone call to say we'd been nominated for Australian of the Year, and we both laughed because who would nominate us?
I remember standing, because I went to take phone calls in the middle of the road because my house is small, and so I would just stand in the middle of my street and take phone calls. And when the lady rang, I was like, I don't think this is right.
So we got nominated for Australian of the Year. got nominated for a podcast award, hit 1 million downloads, and all during lockdown we couldn't celebrate any of those things, but we had each other, and our P's that were listening was so beautiful. And then ACAST, who we run our podcast through, said, your community is quite extraordinary. We think you should do a little thing called Supporter.
They started that, yeah.
So it's like a donation.
It's like Patreon, you know, but their own one, yeah.
Anyway, we're like, okay, whatever.
We didn't want any, we never want to charge for the podcast.
No.
We don't want anyone to have, if you pay for this, you get extra stuff, because we don't want anyone being left out of the tribe. So it's more if people wanted to give us a little bit of money, then there's no conditions about that. So that was a perfect platform for us.
And
so yeah.
Then we get this excited message from ACAST the next day, or maybe 2 or 3 days later, to say that around the whole world, our little podcast, which is a tiny podcast, they have huge ones, had earned more supporter money than anyone ever. Because, this makes me...
I know. It's really
you people that listen to our podcast so wanted it to keep going.
Yeah.
People were like, this is my coffee money, and this is money that I'd saved up for my child's birthday party that I had to cancel during COVID.
Yeah.
And it changed our life.
Buy your kids some Skittles.
Yes, buy your kids some Skittles. And we'd tell a story on the podcast about something that had happened to our kids. Here, go and do this.
Yeah.
So
buy a new Gorman dress I got the other day.
Yes.
I was like, okay.
So we thought we do use that money to run the podcast. We pay for someone to do the show notes. We pay for someone to edit it. It takes us all day to do it now. So we need a little bit of money because we have to step away from our other jobs. But we wanted to give back. So I don't know if you can still see the PowerPoint, but there's a little thing up there that says Letters to You, a booklet of hope for parents. What we did, which we are so proud of, was we got 7 parents or an adult living with disabilities, and they wrote a little story that gets given to parents or carers or grandparents on the day of diagnosis.
This is our dream. We haven't not doing it just yet, but it's coming.
It's coming probably around Mother's Day this year for our 2-year anniversary. So it's nearly at the printers, and that ACAST money that people donated to us, we are going to pay for this booklet. It's free. So no doctor, hospital, or anyone will ever have to pay for it. And on that day, when sometimes you get given the worst case scenario and you look at that little child or that 4-year-old and you think, who are you? We see you and we know how much you love them. And all we wanted was a baby to love, and you still have a baby to love, but you've also got this beautiful booklet to go home with. So you don't just get the bad news, you get some of the good news, right? So,
and everyone, we didn't want it to be cerebral palsy specific or any autism specific. We wanted it to be as our tribe is, whatever.
Yep. So we've got lots of lovely people who've written in. It's beautiful. I mean, that's what we're saying. We wrote it. And we are initiating, which you are most welcome to join, International P Week.
Yeah.
So from the 2nd to the 9th of May this year is P Week, because that's Mother's Day week. And that's sometimes a really, really hard week for lots of reasons. Maybe you've lost your mum. Maybe you've got a complicated relationship with your mum. Maybe your child just got a diagnosis. Maybe your child has cancer. There's all these things that make Mother's Day really tricky.
I remember telling my mother-in-law about our cerebral palsy diagnosis on Mother's Day, because it was the first time I'd seen her face to face, and her face, and I was just like, it didn't even occur to me that might be her memory on that day.
So we know that Mother's Day can be tricky, but we're going to make P Week great. So we're going to launch our booklet. We're going to have a live show in Melbourne. Fingers COVID crossed.
8th of May, hopefully.
We're going to put our little podcast every day, and we're going to support our Ps.
Yeah.
So our book is coming out on the 2nd of July.
Yep.
It's called
The Invisible Life of Us.
Yeah. And you can pre-order on Booktopia if you want. You don't have to. You can borrow it from the library.
Yeah. So we're very excited about that. And that was one of the names that my friend Kylie suggested to name the podcast. So we're thrilled. She has twins too, one with cerebral palsy. So we just want to include our people in everything.
Everything. So everyone is welcome. You're welcome to follow us on Instagram, Facebook,
Twitter-ish.
Yeah, Twitter-ish occasionally.
That's me.
Yeah.
Kate's better.
And once again, thank you so much for having us. We wish that we could have met you all.
Yeah.
But next year.
Yeah, maybe. So if you've got any questions or anything.
Next year. So you can hear me, can't you?
Yes.
Yes. Great. Thank you so much. You ladies, the energy that you guys bring it's energizing to be in the same space, and that's over Zoom. Imagine having you in the same room. We'd all be,
yes, it's a little bit too much sometimes, I think.
We'd all be like we'd had 10 cups of double espresso or something. So I've got a couple of comments that I wanted to make. One is and these are messages that came out for me, that one of the things about team for you guys has been that shared experience. Like, it's finding that you can build a team based on all the things, and you might not even realize they're there. But once you start talking and communicating, you can find that shared experience. Is that, am I making that up? That's something I've got from you.
When I was at the school gates, I was trying to find my people, and they didn't have to be a mum with a child with cerebral palsy. I have a great friend I met at the primary school who had her leg amputated when she was 19. Anyone who was going through something on the road less traveled, right? I was just like, you're my person, you're my person, you're my person. We didn't have to be the same thing. I just could kind of spot if something was going on for them.
Yeah, and I think we were longing, like, to find that, well, we call them tribe, team, and we couldn't always find it. So that's why we started the podcast. But it's also what we've realised is, because a lot of our listeners do not have children, are not in a relationship, never want children, or are professionals or doctors or allied health. They listen, one, because we talk about interesting things that can help them in some way, but two, because they're drawn to our friendship. So that shows the power of friendship and the power of connection. So Mandy and I have lots in common, but we have a lot that's not in common. So I think that's what the podcast has taught us. You know, your child might have this, your child might have nothing, they might be boring, but we have another thing in common. We all love books. You know, there's something.
And I think one of the things from the professionals that have emailed us, particularly teachers, have said that the way we talk about stuff, we're not directing it at one person. So they can just sit and listen, and it's not a personal attack. So they can just absorb, think about things from a different perspective.
I think too, in that same space, you know, you guys talking about that experience can be a one that we'd like there less to be, like loneliness or isolation. But at the same time, and that can be shared, but at the same time, there can be the shared joy of loving our kids, and all of that stuff comes together, and it just kind of organically blends, doesn't it?
I think once I know for myself, there was many years that I was desperately sad. And then once I started just looking into my daughter's eyes, laughing with her, she's funny.
Yeah.
There's not always funny times.
No.
But there is funny times. And so when we started sharing that, and we're like, why should we not be sharing how funny our kids are?
Yeah.
Yeah.
I love that, because it's important for organisations too, and our support groups, to think about, well, what are the things we need to like, the serious pillars that we need to have in place, but to remember the fun stuff too.
Yes.
And that's how you serve your community, isn't it? By being someone they want to be on your team too.
Yeah, they do. Yeah.
And it's okay. We have had very sad moments, both in our personal lives, our parenting lives, and our podcast life. But I don't think there's been a podcast that we haven't laughed.
No.
So we cry and we laugh, and that is life. I mean, laugh and cry every day. Me.
Yeah.
So that's life. Why not reflect it?
Yeah.
And I really like too that you ladies celebrate what you're good at.
Well,
we're getting better at that. We're getting better at that because, I suppose we're a bit self-depreciating in the beginning. Yeah,
but you can be that. You can be self-depreciating, but you can still celebrate the good. I mean, your humour is who you are, isn't it?
Yeah,
that comes through loud and clear. But it's such a joy to listen to you because you are that. You bring that humour, but you also celebrate and point out to us, notice this.
Yeah.
And I think that's
too.
Yeah.
It's wonderful to have you on our team doing that for all of us. Don't stop.
Oh, thank you.
We're not stopping.
No, we're not stopping. I mean, we're putting money into props. We've got a bin here.
So is that's a question that we have. What's next? Is that it? Props?
And getting back to live shows. Yeah.
Yeah. So we would like to be able to put out 2 podcasts a week. That would mean that, we have to know that we're going to get the income from that. We've been very, very lucky with sponsors. Really, really lucky that, because a lot of podcasts struggle. And at first, I think our management team thought, oh, no one's going to want to be with you. But actually they do, because our listeners are genuine, they're engaged, and we are actually genuine and engaged. So our community is unlike any other community. So we've actually done okay. We couldn't live off it without sponsorship. So we'll do a book. We're probably going to write another book.
Yes.
Because we got a 2-book deal. And
this one we want to include more P stories.
Yes, the
this
next book.
Invisible Life of Us is basically Kate and I just talking throughout our story. So including more of the P tribe in that. We're not sure how to structure that yet, but anyway,
that's future Kate.
We have all these ideas, and then Penguin go, no. But they've been fantastic, and we're astonished.
Yeah, we are astonished. So the podcast, we don't know, it grows and evolves.
I've got bookings till the end of June. Like, I've got a huge long list of people. So we'll keep interviewing people for as long as we can.
Yep.
Well, one of the other incredible women that we've spoken to today said that one of the things you have to do is kiss a few frogs. So, and I guess that's a good message for all of us. Just keep turning up, keep having a crack.
Yeah, that's right. That's
absolutely.
Right. Yeah.
Yep. And no one knows what they're doing.
No, and because we said that from the beginning, people are kind to us. We haven't come in claiming to be anything but who we are.
No, there's no Crenshaw here.
There's enormous power and strength, though, isn't there? In if no one knows what they're doing, maybe there's a bit of, everyone's got just a little bit of an inkling. So if you bring it all together, maybe you've got something.
Definitely.
One of my twins, I was telling him that I think it must have been that we were nominated for Australian of the Year. And he was thinking about it, and he said, do you know why people like you and Mandy? And I said, no, not really. And he said, because you don't know what you're doing. And people, he said, when I'm at school, I often don't know what I'm doing. And I find the other people that don't know what they're doing, and we stand together. And it was so profound. He said, Mum, you've stood together with all the mums that don't know what they're doing. And I was like, oh my God, where did that come from? And then next minute picking his nose. But I think there's power in not knowing what you're doing.
Out of the mouths of babes.
Oh, so many. I mean, we pretty much every episode includes something funny our kids have said, because they're our teachers.
They are.
Yeah.
They sure are. And on that profound note, I want to say thank you so much for sharing your story with us and sharing a bit of a back look into what goes on behind the podcast as well. So I feel like we've had a bit of a sneak peek sort of under your skirts, for want of a better expression.
Someone pay for that.
And just having your energy with us today has been wonderful, and we hope to have a long association with 2Ps and a podcast.
Thank you.
Thanks again. Enjoy Rare Disease Day on Sunday with your families, and I hope you get to do something special and laugh a lot that day.
Thank you.
Thank you so much, everybody.
Keep going, everyone. Keep going. Okay. Bye.
Bye. Aren't those ladies wonderful and inspirational for all of us? And that's a really great note, because we're getting right to the end now, and I'm just going to take a few minutes to wrap us up, and then we'll be done for the morning or for the day. We're now into the afternoon. So I just wanted to say that there are always opportunities for you to be part of our team and to be involved with us. And that can be, and I've just listed a few things here. You can get involved with us in putting submissions together, in working together in the same physical space, hopefully in a post-COVID environment. We'll see how we go with that one, with our grant boot camps, with accessing our volunteers, and getting involved in things that you see through our communications. So you'll see in our What's On at the GSNV communications, you'll see lots of notifications about what we're doing in that Share for Rare space that I talked about. And if you would like to access our skills, or you would like to add your skills to the pool so that others can use your skills, we would love to hear from you. And we'll be looking for your resources as well. So watch out for what's happening in the Share for Rare space as well. Hopefully we can support each other as well, and even more in the year ahead. And just one last important thing before we wrap up. I'd like to say to my team, thanks for all that you do each and every day, both for your communities, your friends and family, to build strong community, and to support all of you out there, and to support me and the work of the GSNV, and to actively continue the development of our team and bring the ideas and bring the knowledge and the skills. We're very blessed, and I'm really grateful to my wonderful team. I'd also like to say thank you to you for all that you do, for being such important team members of the GSNV, and to make the commitment to you that we will be on your team, we are on your team. And please, let's work together to change the trajectory of people with genetic, undiagnosed and rare disease in this country. And let's make today the first day of the future for people with genetic, undiagnosed and rare conditions. Thank you. Have a great day on Sunday, and thank you for being with us today. Good afternoon.